Isabel, are we able to unmute people if they call in?
I believe that's a limitation of Zoom.
Okay. Because I'm wondering, I know that John Santa was going to call in for part of the meeting, so I'm wondering if that's his number.
Yeah. When I tried to do that for a board meeting, I couldn't, you couldn't hear me. That is a limitation. We're not at quorum yet, are we? Even with John?
Let me count. 1, 2.
I'm not seeing Richard yet.
If it is John, then we are at quorum.
Oh, here he is. Here's Richard.
Oh, great.
And I don't think there's any, well, he's obviously calling, so he can't text either, but do we know that that's his number, John's number?
Yes.
It is. Okay. So it looks like we may be at quorum then. Is that right?
Yes, we are.
Okay. All right, so we'll get started. I just want to welcome everybody to the December Finance and Revenue Committee meeting. Believe it or not, I counted this. I was kind of thinking about how long we've been meeting, and this is our 15th month. So congratulations. We're getting close, I hope. So today we're going to, I know that there have been some comments about materials and when they're received, and we're going to deal with that during the meeting reflections time and talk about how we can get materials out in more advanced time of the meeting. We have an idea for that. Let's see. I think that was all that I was going to say. So we'll go through the agenda. So I know Director McDonald will give us some updates on on the board and other committees. And then we're going to start with startup costs actually for the reserves. I know it doesn't say that on the slide, but we're going to start there. Then we're going to go into the revenue option refinements and probably split that up into two parts with, oh yeah, sure. Thanks, Charlie. I knew I'd forgotten something.
We'll get there.
Okay, I'll just finish this and then I will do roll call. And then we're going to talk about our remaining work and the timeline. And then again, we'll get to the meeting reflections. I don't believe we have any verbal public comment, but we do have 2 or 3 written submissions. So with that, let's do roll call. Thank you for the reminder.
Great. Cheryl Ramirez.
Here.
Thank you. Chen Wei Chi is absent today. Mary Lou Henrich. I'm sorry.
Here, sorry, I'm stuffing down the last of an English muffin.
Thank you. Poor timing on my part. Richard Gibson.
Here.
Thank you. Jeff Goodman.
Here.
Thank you. John Santa is listening in. Bethany Sayers. Is not here yet. And Charlie Swanson.
Here.
Thank you. That's everyone.
Okay, looks like we have quorum. Oh, one other thing I was going to mention is that we had extended an invite to 2 people to join our committee, and I think one took us up on it. I don't see her here yet, but if she comes on, I'll introduce her. All right, so with that, I believe I'm just going to hand it over to Mimi.
All right. Good morning, everyone. This is Mimi McDonald. I'm the Executive Director of the Universal Health Plan Governance Board. I thought I would lead off with just showing everyone this is the mission statement that was adopted by the board at the last board meeting. So it has gone through, sort of was initially developed, I think back in, I want to say April, and has gone through a lot of work, both with the board members and with our community engagement and communications committee, and come back and forth. And so I think I'll just kind of give people a chance to read that. All right, and then we'll go on to the next slide. We're going to talk about our board and committee update. So our last board meeting, as all the people who attended it can attest to, had a packed agenda. So as I mentioned, there is a mission statement, which was approved. There was a more kind of a more detailed review had happened the month prior, but the board did approve sending the 2025 annual report to the legislature, which went out this past week. There at the board meeting, there was a communications policy update, mostly having to do with how the board is going to do presentations regarding the Universal Health Plan Governance Board and kind of just formalizing that so we have a consistent message that is being spread and how we go about doing that. There were 4 straw proposals that were reviewed, and course, either completely or portions were approved for more work. So that was on administrative structure and quality. Those were approved. The revenue, as we'll talk about, which was reviewed, and then the hospital payment system. So I don't know. I'll take just a moment to see if Chair Ramirez or Mary Lou Hendrich would like to say anything else about the board meeting they wanted to share to this committee.
I'll invite Mary Lou to say something. I wasn't present at the
Oh,
last
that's right.
meeting,
We
so
did miss you.
yeah, sorry. Mary Lou, do you want to say anything?
Yeah, it was a very, very packed agenda. And in some ways, a frustrating meeting for me. There were just a lot of things that when you get down into the details on these straw proposals and really, in my mind, don't always have a lot of time to really kind of think about them, go back and forth in your own head or with talking with others. I know we're under a very tight timeline. I know we have, things we have to get done. So I'm not sure I have, an answer to my frustration, but I think the staff is doing, a yeoman's job for the small amount of staff that we have and the lot of work that we're doing. So I don't mean this to be critical of them or really of the whole board process, but the other the other thing is that we're a small board, and when people have to be, for various reasons, absent from the meeting, that also takes away, I think, from some of the kind of depth of discussion that we can have on some things. So, we are doing the best we can. And I think everybody is in the right spirit of wanting to move this forward and wanting to come up with the very best possible plan that we can present. So anyway, I just hang in there, and that's what I'm trying to do, and trying to, read things, think about them, listen to input, and I think the board members are doing a good job of that as best they can. So that's
Thanks
about
for
all I
your
have to say.
Thanks for your candid feedback, Mary Lou. And I would say my feeling is that if we don't believe a particular topic or straw proposal has been discussed in enough depth, we could always put it on the next board meeting agenda. I don't think it's like one and done type of
Right.
thing.
And I'm also, excuse me, but
Yeah.
I also believe that these are straw proposals. They are preliminary proposals.
Mhm.
They will have to somehow in a plan all kind of fit together. I don't know that, if we took this jigsaw puzzle at the moment and tried
Mhm.
to do, to fix that, to make sure that they all went together. I'm not sure that they really do yet.
Yeah, that's right.
But that's coming, and I do agree that if there are things later, we can go back and we
Mhm.
can say, yeah, we passed this as a straw proposal, but in light of X, Y, or Z, I'm thinking maybe we need to talk again about QRNS.
Yeah,
So,
totally. That's a really good point. I think we're gonna have to spend some time putting that puzzle together, and we haven't been able to do that yet. I'm hoping that will be an early 26 thing, or
Yeah.
the first half of the year. So,
right.
yeah, sure. Thank you.
And my only other thing is that this isn't so much the board, and maybe I'll save it for reflection. I'll save it. Okay.
Thanks, Mary Lou. Back
Thank
to you,
you.
Mimi.
Thank you. All right. Operations Committee, also hard at work, had at this last meeting reviewed an integrated primary care and behavioral health payment model. Building off on the work that's already been done from the Plan Design and Expenditure Committee meeting, and really just looking at ways to really adapt those models that are already in effect in Oregon, like the CCBHC, which I'm gonna, if anyone asks me, I will never remember what that acronym completely stands for, but it has to do with behavioral health care in community and integrated, and also the PCPH, which is the patient-centered primary care home, that acronym I can remember. So kind of, again, building on the strengths of what has already been developed in Oregon. Also, there was further discussion and delineation on eligibility and enrollment, and that is ongoing. And again, sort of operations is now taking over some of the information from the Plan Design and Expenditure Committee and doing exactly what it should be doing, which is figuring out how to operationalize it. And then we just started the fun discussion about what a transition committee will look like, and we'll have the opportunity in this committee. Thank you, Cheryl. CCBHC, Certified Community Behavioral Health Clinic. We will have the opportunity later, I said, in this meeting to talk about the work that a transition committee would be taking on and how they would be doing it and when it's all going to happen. So more to come on that. Plan design and expenditure. Again, probably the biggest thing at the last meeting, Milliman gave their initial benefit cost estimate. So a status quo estimate on the healthcare cost in Oregon using that all payer, all claims data. So starting to do an update now. During that meeting, a lot of things were brought up, and they have made significant refinements. There is a plan design and expenditure meeting coming up. Sorry, I'm looking at my calendar. Yes, just this Thursday on the 4th, where they are going to go over all of their sort of the revisions to that estimate. So if people have the opportunity, please join. I think it's going to be very elucidating. Yes, Mary Lou.
I guess my question really is, I think that the work they are doing, has a lot of implications for this committee. And I'm feeling like with kind of the way the quote rules are right now, that if we as committee members, go sign on to listen to plan design on the 4th, we can't really ask questions or give input. And so I'm just trying to think, I think this committee has, before I ever came on, had been asking for time to kind of maybe meet jointly or to have some kind of more connection than we feel with that committee. And now that Milliman is kind of presenting to them, I don't know, it just feels a little disjointed to me, and I don't know what we can do about that, but I just wanted to raise that. And if anybody else had that as a concern, or maybe it's just mine. Thank you.
Thank you, Mary Lou. No, I think that has definitely been brought up. Charlie, go ahead. And then, sorry, Cheryl, I didn't mean to interrupt you.
That's okay. I was just going to add something about Milliman.
So I had the same concern. We're going to need to respond to the details that Milliman puts forward, and presumably the board seems to think that we should be disbanding this committee pretty soon, and we won't have a chance to respond to Milliman in a meaningful way. So I would urge us to say that we really do need to continue to meet and respond to Milliman in a meaningful way. Otherwise, we're not going to have the sort of plan that we need to have. So I'll stop there.
Could I just interject? We were talking about this yesterday at our prep meeting for the committee meeting, and we're going to invite Milliman to join us in January to talk about their last version of their data, and then that will give you an opportunity to ask questions, compare and contrast with our revenue proposal. So that's going to be on the books.
It looks like Jeff.
I agree with Charlie.
Okay, Charlie, do you have something else?
Yeah, I was just gonna say, if we get that information in January, then presumably we'll be able to think about it a little bit and come back with some notions in February, and then perhaps we'll get some more public comments, et cetera, and we'll then be coming back with something more in March. And my understanding is that the notion is we won't be meeting that long, and I'm just finding out that we need to be. So
Thank you. So one other thing that we brought up, and this was working with Echo Northwest, and sure Morgan is on here, might be able to help me out here and jump in. Part of what is to happen in the months, this is of December and January, is for Echo Northwest and Milliman to work together to take that data, the Milliman's new uh, the status quo estimate. And then they also have a universal health plan governance board. If things were to be the way that they were, that estimate as well, and update the estimate that we have been using. So in other words, to mesh it. So I don't know, Morgan, if you have a moment, if you're on yet, if you have a moment to speak to that.
Yep. Yeah.
Thanks, Morgan.
Lots of moving pieces. Think of everybody's left the station on different tracks, and we're all have to kind of get to the same places to check in. I think what we're trying to do, Charlie, is I think their new estimates will be coming out after our meeting today. And so we're going to take that information and think of it as basically the things that we can settle on today on the revenue side, then incorporate those new estimates, and then think about like, well, what needs to change if we're working off a different sort of potential, planned expenditure cost, what our new cost target needs to be, and then how our structure may need to change, and then hopefully bring that all to everybody in January, kind of the sync up. So Milliman will present on what they're having. We'll have some time to kind of think about the revenue structure based on that during December, and so that we can try to bring that up in parallel and at that same point in January. And therefore, hopefully everyone can then talk in January about like, okay, here's Milliman's things. Here's our revenue proposal that is in sync with Milliman's cost plan and what we're trying to solve for, and then have some discussion. Hopefully then we can narrow things down to February. Does that make sense, Charlie? And Richard, I know we talked about a little bit of this offhand, and I know Mary Lou's got her hand up too.
It looks like Mary Lou is next.
I guess my question really is about the we in December. I'm feeling a little bit like the committee, and I joined late, so I'm not, haven't done anywhere as much work as some of the other committee members have. But I guess this is our committee, and I kind of feel like things are going on behind the curtain, and then all of a sudden, the day before or whatever, something comes out, and there isn't really time to really think about it or to talk among the committee members. We have our rules where we're not supposed to be doing too much chatting, and all the public meeting stuff. So I'm always kind of a little nervous. I know we can talk individually, but I don't know. I'm just kind of wondering if there isn't some way that the committee can be a little more involved in December with whatever it is that you're doing, before all of a sudden it's kind of like, here it is presented again. It feels somewhat like things are pretty well cooked by the time the committee gets them. And then we either have to kind of go question them or debate them. And I don't know whether maybe Cheryl and Mimi are doing, I mean, I just don't know. I think things are not as transparent as I would like them to be as a committee member and a board member.
Thank you.
Go ahead, Charlie.
So I guess my point is I don't think that's sufficient time. I mean, I guess I understand that maybe Echo Northwest needs to be done, but I don't think at some point pretty soon. I don't know exactly what your contract is, but I think the committee needs to continue working. My expectation, at least from what I saw from Milliman at a first, the first presentation, is that there's going to be a lot of contention about whether or not they're making credible estimates. Now that may change. We'll see what it is, but I don't think it's I don't expect that we're going to be willingly accepting what Milliman has to say, at least at this point, from what I can see. But again, I will say that might change. But I expect that there will need to be some back and forth, and that we'll need to have some time on it, and that the committee will need to be involved in this for a while. And that is my my point is basically we need some time, and we're going to need to respond carefully to what's going on. And we don't want to inappropriately stop the conversation.
Cheryl.
Maybe before you go, Cheryl, I'll just
Yeah,
just to close
you
with
can
Mary
respond,
Lou's
that's
question.
fine.
Yeah, so Mary Lou, I would just say, Richard and Charlie particularly, and then Richard, right, have been doing so much sort of heavy lifting, and so I would say the work that's been done has not been kind of decided. Think of it as basically the committee is sort of providing direction. We're trying to do analysis to inform that direction, then bring it back to the next piece so you can discuss. Part of here is just like an arrangement where Charlie has done so much analytic work here that he's been heavily involved I'll just say an analyst, right? And so I think it's not kind of the tail wagging the dog. I think it's really kind of we're trying to take the direction from these conversations, do some analysis to update it, refine, bring it back for review and direction, as opposed to kind of going in any new direction, if that makes sense.
Can I respond? I think it makes sense, yes. And I don't have any really complaint, Morgan, about what you guys have been doing. And I know you've been working with Charlie and Richard. I guess it's just more the feeling that this committee, I think, needs to be involved with what Milliman's doing and has not had, their presentation, kind of came at the last moment and it went to the other committee. I just think it's some of the communication pieces about how do we find out what's happening and how do we have input in between. And I know there's very tight timelines, but somehow that Milliman report that wasn't posted where, you would find it, I'm having to go to every committee and look for if something's been posted. It's kind of like as a board member, and then also as a committee member here, but to kind of be alerted that something like that, because it was, kind of came out very last minute, it felt to me. I mean, I know everybody's working hard. I'm really not wanting to sound terribly critical. I'm just going, how can we make it better so that all of us who are deeply committed to this work feel that we have enough time to really think about things, to know what's going on in all the parts. And I can imagine that Mimi's head is swimming. So thank you.
Thanks, Mary Lou. Jeff.
Once again, I agree with Charlie and Mary Lou. And the second question is, when I've had conversations with people who are aware of my being involved with this committee, and they've asked me a simple question, which is, hey, Jeff, if I get a broken leg and go to the hospital, what's it going to cost me? And I couldn't answer the question. So I hope that we can get somewhere along the line, either today or very soon in the future, have an answer to that question.
Thank you. Cheryl.
I just wanted to respond to Mary Lou since you mentioned me. I'm definitely not doing any behind the curtain decisions with Mimi. I do get a preview of the work that Morgan, Charlie, and Richard have been doing, as has already been said. They're doing the heavy lifting on the data analysis and revenue options. And then I do hear about it before because I'm the committee chair and I have to help run these meetings. So I need to know. But I think, and I know we were going to talk about this in reflections, but I think one of the challenges for all these consultants and the staff and now Richard and Charlie are that it's very difficult to get meeting materials out in time when we have 2 meetings a month. That they really need more time in between the meetings. And that's why you're getting things at the, seemingly last minute. It's very difficult to turn those complicated data analysis proposals and charts and all that work around in a week or something like that. So that's one of the problems and that they're having. And like I said, we've invited, or we will be inviting Milliman to our next committee meeting, and that's the best we can do. As Mimi said, their new or their revised data isn't coming out until this week, right? Mimi, is that what you said? So
Yes, that's correct.
you couldn't do it today. Yeah, so that's my response.
Mary Lou.
Can I just respond? I didn't mean behind the curtain and however that came out. Because I wasn't questioning that, Cheryl. I was just saying there is a lot of stuff that's kind of having to go on. And I know that Charlie and Richard have been doing unbelievably volunteer, unpaid work that is really essential to where we are. And I'm glad they're there. I trust them. It just is kind of frustrating when I'm trying to figure things out myself too, especially I think in my dual role as both a board member and a committee member. And what does that exactly mean? And have I had time and been able to process it with their minds too? So anyway,
And I don't, yeah, and the other thing I was going to say is I'm not sure if this is a problem for public meeting laws, but I don't know how many people can be copied on their back and forth emails, but maybe that's a way for you to be informed. I just don't know if that's possible. Mimi's shaking her head.
Yeah, no, then once you get a quorum going, then it's a public meeting.
That's the problem. And this is a fairly small committee. So
thank you all. I'm done.
All right. So as mentioned, plan design and expenditure meeting in 2 days. And this, when I give this presentation, and I do it at every committee meeting, this is the time when I really do try and highlight for people who are on the committees and then on the board what is coming up, so people can plan around. So for example, saying when there's going to be an operations meeting or plan design and what is on the topic. So that's part of what this communication is about, trying to highlight those things. So speaking of communications, our community engagement and communications team, a couple of things. We're working with Diana Bianco for the upcoming engagement meeting that will be happening probably in February and March. I also did a sort of a timeline update then. And then, although the Community Engagement and Communications Committee meetings, those are going to be on pause until April of 2026, because they have completed their sort of initial workload of developing all the communications materials. They will have an interim meeting in January just to kind of get a catch-up meeting. And then again, starting up again in April, when all of that information is coming back from those targeted engagement meetings. And so they will be able to kind of digest that and then also start working on a broader dissemination plan. So looks like Charlie has his hand up.
Yeah, I'm going back to plan design and expenditure. I see on there the LTSS review. So what is the status and the thinking about LTSS at this point?
Yeah, that's a great question, Charlie. So a final decision would be made at the board level. It certainly hasn't been made. And so the plan is there's going to be, because essentially at that last meeting, there was kind of a review. Lee Hastings did an amazing review of sort of how long-term services and supports, people aren't familiar with that acronym, are paid for in Oregon, and the utilization and the costs and things like that. So that was brought to the committee. Milliman, when they do their revised estimate, are going to do it one version taking out the cost of long-term services and supports, so that in the possibility that it might be covered in a different manner and not under the Universal Health Plan. But I want to reiterate that decision has not been made. So please understand that. There will be, at the January meeting, further review of that very topic. So sorry, that was a really long way to say that, Charlie. I apologize, but basically that it's in consideration that the funding would be kind of outside the purview of the Universal Health Plan. Obviously, it would still be funded. There would still be the same dollars, but not necessarily. But again, final decision not been made, not even at the committee level. So,
Okay, thanks.
okay, thank you. Okay, and I think that is it for me. So unless there's any more questions, I don't see any hands. We will turn it over to our colleagues at Echo Northwest.
Great. Well, I'm just gonna let Sarah take it away here.
Thanks, Morgan. Hi, everybody. I'm Sarah Emmons. I'm a consultant with Echo Northwest, and I've been leading the research on Operation Reserve and Transition Funding. I'm going to share the slides that I started to share with you last month, and I've made just one update to them. I'm not sure if they were shared with the committee, but the new information relates to the community care organizations, which Charlie had asked us to do some additional research on. You all were understandably a little preoccupied with bigger questions about revenues last time I talked, so a little bit of this will be a repeat, but I'll try to move quickly through the part that I covered last time and then spend a little more time on case studies. So again, this body of research is relating to the costs of implementing the Universal Health Plan program before it becomes mature. My understanding is that the revenue proposal you all are considering relates to kind of a mature program that's at scale. So the work that we're talking about today relates to how to pay for everything leading up to that point, including the seeding of a reserve fund, which, as you know, is necessary for best practices and likely would be necessary in any authorizing legislation for this program as well. And my understanding is also that you will not be making a proposal related to this. So this information is considerations for you, and it will be a chapter in the report. So once again, having worked on budgets, human services budgets in the legislative and state agency context, I kind of see this this part of the project as having three cost phases: a one-time cost, a ramp-up cost, and an ongoing cost phase. And how you pay for each of these phases will depend on the costs and the risks. And I know the costs are still being worked out. But they'll also depend on the organizational structure and revenue availability, some of which will be outside of the control of folks on this committee, and more related to fiscal and economic considerations. I was not able to find a program at the scale that you all are considering that has a set-aside reserve that's funded with public dollars. So we'll talk a little bit about North Carolina and their Medicaid contingency fund. And then we'll look at a few different case studies of programs abroad and in the US that have lessons learned. This is a reminder of the three phases we talked about last time. So again, you have your one-time costs. These will not be kind of built into the operating model of the program, but are definitely necessary to get it started. I imagine that the technology investment will be substantial, and so that's kind of called out in the top of that left-hand column. The ramp-up cost period, you'll still have one-time costs, so you'll still be building out your technology systems. You might have a couple of years of administrative operations that you'll need to have in place before the program begins to provide coverage and make payments. And then there's also some costs related to sort of instability and unknowns related to your caseload and payments and your revenues, hiccups or bumps that might be happening as the program gets to scale. And then, of course, your ongoing cost phase, which you all are working on, very familiar with, where the goal is for the program to be self-funded, including a reserve fund, which would be required likely for legal reasons. You can stop me if you have any questions. And then this is just a diagram that kind of aligns the risks as I see them with each phase. So on the one-time kind of initial investment period, you have operational risk, but you don't have as much financial risk because the program's not yet on the hook for providing coverage. So really your risks are likely in kind of keeping it on track and keeping things moving to the point where you will deploy the program. The ramp up period has both operational risks, so you're still running the risk of delays, but once you're contractually or legally required to provide coverage, that's where you have your greatest financial risk, especially because, as we just discussed, there will be considerable unknowns in caseload and revenues. Jeff? I think you're muted.
Apologies. Thank you.
No worries.
Do you have a ballpark range estimate for the one-time initial investments and the ramp-up period?
I don't, and I think that this is where I'm sort of the new kid on the block in the consultant team, but it also sounds like there's a lot of pieces that you all are considering as a part of your committees. My understanding from talking with Morgan is that there is a transition cost estimate that's being worked on. I don't know which committee will be considering that. And as far as the ramp up period, I think that would probably relate to some of the decisions about how to operationalize the program. I'm not sure if it's going to scale immediately, if there's going to be pilots or population groups that are brought on. So I think the kind of probably unsatisfactory answer is that it really depends on a lot of decisions that are still being made.
Do you know when we might be getting that information?
Does anyone else want to
Yeah,
answer that one? I
maybe
think
Mimi,
I
you
don't
can
know.
jump in there.
Yeah, absolutely. Thank you. So it is true. Some of it is going to be decisionally dependent in terms of how the transition team sees rolling things out. I would say that's kind of that ramp up period. Right now, Milliman is working on, and as I mentioned, at the plan design and expenditure committee meeting, they will have that estimate and for the sort of total cost. But at the operations committee meeting, which is the following week, sorry, I keep looking over at my calendar, which is over there, which is on December 11th. There will also be a very robust discussion of the administrative structure and including estimates, and actually they will present an estimate of the some of the ongoing administrative costs, and again, depending on decisions, then there'll be some of the, because decisions have to be made about the investment in, I would say, in infrastructure is probably going to be the biggest one in IT. That's still being made. So, you know, maybe these things will be coming around January, February, some more numbers. But again, I would like to say that some of these decisions will be made at the board level, and some of them may not be completed until May or June. So there is going to be a moving target, even though there will be work going into estimates, not necessarily the dollar amount, but like how can that funding be realized? So long answer.
And I think that just reinforces the message that Charlie has been making quite eloquently today, that having our committee shut down in January, February is a mistake. But perhaps I'm too blunt.
Thanks, Jeff.
Well, hopefully what we can talk about today, even if we don't have dollar amounts, is just sort of a way of thinking as you do hear that information. And I understand there are bigger questions about the ongoing work of this commission or committee. So one of the things actually, Jeff, that I wanted to kind of get us thinking about today is sort of aligning those cost phases with available funding, which is kind of shown in this graphic, and strategies. And I imagine that kind of like highest risk period, that's that ramp up period, you will need kind of multiple tools in the quiver. But probably a lot of it will depend on the state fiscal environment at the time that, you know, appropriations, if that's the route the program goes, will be requested. So I went over this last time, but these are funding sources. So the funding is like where, you know, what is the money or where is it coming from? And then financing is sort of like how you use it to pay for what you need to pay for. So from left to right here, we have a couple different options of state funding. Of course, an appropriation could be requested for any of the phases that we just discussed, unlikely the ongoing phase. And a loan could also be requested from the state. And I bring this up especially in the context of the information technology investment, because the state does have a sophisticated way that it pays for large scale in IT. And of course, whatever systems are used by the Oregon Health Authority, for example, would fall under that umbrella of how the state pays for it. It's also likely that even if this program were a separate entity, it might not have the credit worthiness, or it might have a higher borrowing cost for an information technology program than the state would. So that's one avenue that, I can imagine the state being helpful in paying for some of these transition costs. The middle block refers to own source, and by that I mean revenues that this program will be collecting from the tax that you all are discussing. We have at least one example of a tax that's pre-collected, so we're going to talk a little bit about paid family medical leave. I'm not sure if that's legal in Oregon, but it is one question that this committee could ask. I think somebody else on this committee also brought up the question of whether the tax could be temporarily hiked to pay for some of the startup costs or to seed a reserve fund as the program gets started. Federal sources of revenue are on here, that there is a precedent for waivers and enhanced match for investments in information technology, although of course the fiscal climate is unknown there. And then we also talked about savings reallocation, and the one new piece of information here is Charlie's suggestion of including the community care organization reserves. This is still grayed out because I do have some questions about legal questions and just financial questions about how much money we would be talking about if we were looking at that. Charlie.
So one of the, I guess, maybe potential sources would be getting a bond that is, or I guess issuing a bond that is paid back by future revenue. Is that a possibility for something of this nature, that you could say, we're going to have a future revenue stream with the new taxes that will be coming in later, and that will pay off the bond that we're getting now?
It's unusual for states or state-supported programs to have operating bonds. They've tended to do not very well in those situations, which is why I brought it up primarily for the infrastructure needs. But I think it's a question worth considering, just in case there is, a precedent for it or some reason to look at it. Okay, so then we think about aligning the costs that we talked about with various funding sources. And this is, because this might be one of the last times I see you all, I'll be a little bit more blunt than I was last time. I think that for the startup period, a state appropriation is very appropriate to request, because usually with the startup period, it's like, well, obviously you don't have revenue coming in yet. But your one-time costs tend to be a little bit more easy to predict than your ongoing costs. You're also standing up a public good, so a state appropriation of general fund dollars does seem appropriate. You're establishing a program that's going to serve all people in Oregon. And as I mentioned before, you're at a high operational risk period, but there's less financial risk. In fact, with newer programs that I've seen stood up in state government, you tend to have more underspend than overspend at this period, because you just can't, governments are, sometimes a little bit clunky. They can't get things started as quickly as they plan to. So you might have some savings to reallocate. During the ramp up period, as I mentioned, I would imagine that it would be appropriate to consider sort of like everything in the couch cushions approach, especially if it's legal to collect the tax temporarily, for a period of time before deploying benefits to precede a reserve fund, which would be necessary to hold for liquidity and legal purposes. There also could be a request for operations support from the state with the promise of repayment now that the program would be collecting revenues. And then, of course, once the program is fully implemented, the goal would be for it to be self-funded and reserves to be self-seeded and startup loans to be repaid if they had been utilized. Does anybody have any questions about this kind of framing exercise? I know it's tough without dollar signs. Charlie?
Yeah, so I have another question. So there are a number of nonprofit entities in Oregon that are involved in healthcare, both insurance companies and large hospital systems, et cetera. And their reserves have been built up for the purpose of providing healthcare to people in Oregon. And if there's a change in the system such that they no longer need those, the nonprofits have an obligation to use that money for the benefit of the society, I guess. I'm not sure exactly what the words are, but to me, at least, especially for some of those insurance companies that are nonprofits that will no longer need to have the reserves they have because they will no longer be involved in the system in the way they were. To me, that seems like another potential source of some of this ramp up funding. And so I'm not sure how you look at that, but I would encourage that to be considered.
Thank you. Yes, and Charlie, because I'm not as familiar with the Oregon context, are you referring again to the community care organizations that you asked us to look into? Or are these different?
That's only a part of it,
Okay.
and it's coordinated care organizations actually is what we're talking about.
Oh, my bad. Yeah, right.
Yeah. But no, so I'm thinking of like some of the nonprofit health insurance companies
Okay.
that are not. I mean, some of them are also involved in CCOs, but there's reserves that exist there for other purposes, not for the purpose of the CCO portion. And so, to me, that's another potential source because they're nonprofit.
Got it. Okay, that's really helpful. We did do some research on the coordinated care organizations, not community care. That's a good transition because I think that some of the lessons that or like observations we have from that context would be relevant to the context that you're talking about. So I'll get to those in a minute. This last slide just talks about the different financing options that would be available depending on how the UHP was organized. I'm not going to spend time on this right now, but there's some information about this in the memo that was shared, and this will be in the chapter that we're drafting for you as well. So to start, it's coordinated care. Darn, I got it wrong in the, header here too. So we did do some research on CCOs, as I mentioned. I think these are an Oregon thing. I wasn't really familiar with them, although I'm not a healthcare expert by any means. But for those who don't know, CCOs are many of them are community-based organizations, which is why I think I was mixing those C words up. And they operate under a global budget. They provide healthcare coverage and services to about 1 million Medicaid recipients out of about 1.3 million in Oregon. And they are authorized under state law and regulated under state law. They hold contracts with the state, and this is where I think some of your questions might come up, Charlie. So we looked at the statute, and they are required by statute and administrative law to hold restricted reserves. And I have the formula here. It's 250,000 plus half of their liabilities, or 2.5 million in capital plus any amount necessary to ensure solvency. I did spend some time with their financial statements. They were definitely very confusing, so I don't have an exact number for that. But I think the point of looking at that is that, thinking about this is that those dollars are held for services that may have already been provided. So they are essentially owed to providers. And so that's, I think, where this question comes up. You know, in a perfect world, the switch flips and those organizations just merge into the UHP. Well, I do think there would be some legal remediation or restructuring required to look at the contracts and how those dollars are held and potentially hold them to make payments for services already rendered. I'm not saying that that means that there would not be money available. I think, you know, not being a lawyer or an actuary are really a lot of things that would be much more useful for you as I'm doing this research. I do think that there would be a lot of work that would have to go into kind of understanding how to restructure those organizations. And in terms of how much money, well, as you can see in the last year that we were able to see a financial statement, these organizations in aggregate, and again, there's 16 of them, so they have mixed results. We're operating at a net loss. So that's not to say there wouldn't be money held in reserves. They obviously have to hold it. It's just that it's obligated to providers. I don't know what order we went in here.
I think it was Charlie first.
Okay.
So I don't know if you can answer this. This is one of the pieces that I've had a tough time understanding is 250,000 for half of liabilities. Well, liabilities over what period of time? And so to me, it's like that. And they actually do list, I think, in the financial statements, the restricted reserves. So you can find out how much they currently have, but it's unclear to me what this half of liabilities means. I mean, like, well, over what period of time?
Yeah, no, I know what you mean. I know in the this is a different kind of organization, but the Oregon Health Sciences University has to hold half of the year. So their operating expenditures are like 5 billion and they hold 2.5 billion. I'm not sure, you know, I'm assuming that they have different calculations that are required. I also think that There's a lesson learned for this committee or for the board as a whole, having read the implementation plan from 2011 for the CCOs that was submitted by the state to the feds. There's some really detailed requirements for financial reporting, and it is, you can tell the amount, but it's hard to put that amount in context of like anything useful, even as a person who spends a lot of time with financial statements. So I think it would be great if this committee would consider, or, you know, in the appropriate format, requiring, you're going to have accountability mechanisms you'll want to build into this plan and financial reporting, but that's transparent and clear to understand in addition to regular would be, I think, a great asset. Mary? Oh, you're muted, Mary.
We have this interesting law in Oregon about mergers and acquisitions. And there was last year, or a while back, I think it was about a year ago now, a lot of discussion about the largest CCO in Oregon possibly merging or selling or doing something with another entity out of state. And there was a lot of information that became available. A lot was redacted, but there was quite a bit of information, and some of it had to do with that amount of reserves that was very large. And so I think there were some questions about whether really and truly there could possibly have enough liabilities to need to use that up. So, but it's all complicated, political, and you know, Oregon specific. So anyway, I'm not sure, but I do think that it is something that will need to be considered and talked about and debated. So that's all.
You know, what was the name of it so we can look into it and include it in the chapter?
Care Oregon.
Okay, thank you.
I have three questions. Number one, liabilities here in that top bullet point probably means payments made over, claims paid over a year. So then it's not liabilities in sense of debt, but liabilities in sense of operational payments.
Unpaid claims.
Okay, so liabilities may have a different meaning there. The second thing is, what's capital mean? I mean, I know what the word capital means, but what's it say 2.5 million in capital? I mean, what?
Yeah, the statute, let me see if I have it. Well, we can follow up with it, but it says 2.5, it says capital or surplus in the amount of 2.5 million plus any amount necessary to ensure solvency is what it says in the administrative statute.
So capital refers to the kind of savings?
Capital, it just means money, I'd imagine.
Okay.
Buildings, maybe?
So it's 250,000 plus 2.5 million, plus half of claims paid in a year, and then ensure solvency of, I don't know what, how you measure that.
Yeah, no, I had the same thought,
Okay.
and like their financial statements are, I mean, because there's so many of them, they're very long. I think the restricted was the first one, I believe, because you mentioned it is payments for claims already made is a liquidity requirement, and that's why it's restricted. And the second one, I think, is like a, you know, if you go broke and your contract has to, you know, like you just hold, you have to hold this capital. I don't think it's buildings. I do think it's like some form of like liquid capital, so that if you go insolvent and you have to break your contract with the state, you can pay your debts, actual debts, not just the payments that you owe.
Okay.
Thank you.
Charlie?
So just to respond to Richard's, the half of liabilities is not the annual, half of the annual costs, because if you look at the numbers, that's not where they're at. So it was very hard to even make a guess based upon, looking at the financial reports of what that meant. So I still think that it's an unknown question in my mind. But somebody in OHA has to know it because they're the ones that have to oversee these and make sure that they're following the rules. I will say that we do have a history of at least one large CCO, family care going out And they walked away with quite a bit of reserves, even though the reason that they left was that they weren't getting enough money to fund the things they needed to fund. So it's unclear in my mind, very unclear, what the law means and what kind of reserves they actually have and how that relates to what they say in their financial statement. Somebody's got to know that, but I don't know who that is. So
Yeah, I'm talking to a contact at State Treasury on Friday, although I don't know that she'll know the answer to that question. Mine was more about kind of, if what kind of liquidity needs there are in state accounts, but maybe we can find somebody at OHA to help. Is that what you were going to say, Mimi?
Yeah, I think too that not even necessarily OHA, although that'd be beneficial, but from our colleagues at DFR, which is the insurance commission lives under. I think that they may be able to help us with this in coordination with some of our DOJ representatives as well.
Great.
And also, sorry, I was also going to say, and Lee Hastings is our very own Lee Hastings, senior policy advisor, has done a lot of work on that as well. So we can, the staff can bring an update at our next meeting.
Okay. So the next case study I have for you is actually, I hate to do this, but it's there in red font, a correction from what I told you in a previous presentation. I think when I met with you last, it was in October. I'd mentioned that the Washington Paid Family Medical Leave Program, which is about 5 years old now, had been insolvent and had adjusted their rates, their tax rates, to be actuarially determined, and that was incorrect. They really want to, they need to. As you can see from the red numbers on the bottom row of the table down there, they're still projecting to be insolvent, but right now their tax rate adjusts based on historical expenses. So I don't believe this committee is considering adjusting a rate, but I bring it up as a there's a couple of like what if lessons learned that can be learned from these other programs. And if you are at a program that's facing threat of insolvency, well, you kind of can adjust the money coming in, which would be a rate adjustment, or you can adjust the money going out, which is a reimbursement adjustment. And we have an example of that too. So I just wanted to kind of correct the record here and let you all know that I was wrong about this rate. Jeff?
Can you clarify what you mean by rate adjustment?
Sure, yeah. So the Paid Family Medical Leave Program is funded by a tax on payroll, and it's split between employers and employees. And right now, the way the tax rate is set, I don't remember what it is off the top of my head, but the way the tax rate is set in Washington is they look at last year's expenses for all the paid family medical leave claims, and then they calculate a rate plus a little bit extra, as you can see here. That's sufficient to pay for that in the next year based on their projections of payroll. So every year the rate adjusts a little bit up to a certain cap. And what they want to do, instead of looking at last year, is to say, well, we're going to look at last year and next year and whatever actuaries do and come up with some rate that adjusts based on what they expect to happen, not just what did happen.
Who is they?
The Employment Security Department in Washington State.
So a independent board, not the legislature?
Well, the legislature wrote the formula for them for the state agency, but ESD is a state agency. So in the context of what we're talking about here, so say for example, the UHP is funded by a tax that the rate of which is written in statute by the Oregon legislature. The program would be receiving money from that. If it needed to be adjusted, the legislature would be the ones that would have to make that adjustment with information from the program.
Just to confirm, I want to make sure I understand. So it's the legislature, if a rate adjustment needs to occur because of you identified the deficits that occurred, it is the legislature that has to say raise the rate.
Yes, that's correct. Yeah.
Okay.
Yeah. And they would.
Thank you.
Yeah. I don't know. So the kind of flip side of that is on this next slide, the North Carolina Medicaid Contingency Fund example. What I don't know, because I don't know well, I just don't know, is if provider rates needed to be reduced because, say, the program was, so the legislature would have to increase taxes if the program were to be at risk of insolvency. And there could be mechanisms built into the authorizing legislation to allow for checks and balances before that happens. In North Carolina, they do have a $500 million Medicaid contingency fund. This is available for appropriation, again, by the legislature in North Carolina. What happened this fall was a little bit of a game of chicken between the governor and the agency and the legislature. So the governor, because the federal government cut Medicaid, the state program was in trouble. The governor was requesting the Medicaid contingency funds to be released to keep providers whole during this period. There was a standoff, and eventually the agency, which is again, under the governor, announced that they were going to reduce provider reimbursement rates, which again, like you have money coming in, you have money going out. So they took, it's because they couldn't get the contingency funds, they were threatening to, well, they announced that they were going to reduce reimbursement rates, and eventually the legislature did release the fund. So I bring that up as just an example of another program that has different mechanisms to deal with the risk of insolvency. $500 million in North Carolina would be about 1/3 of 1 month of expenditures. So I don't have a more recent update as to how they're going to deal with, ongoing federal cuts, but I assume it will be political. This is the example I mentioned earlier when talking about the amount of cash that's held on hand. So Oregon Health Sciences University has operating expenses of $5 billion in fiscal year 2024. Their reserves were $2.2 billion, and this was calculated based on a number of days of cash on hand, which is a calculation we've seen in a number of different contexts. As you can see, the Oregon Health Sciences University is also operating at quite a tough margin, as you can see from the right-hand side of that chart. So another example of an organization that does have substantial reserves, they're required to hold them, but it doesn't mean that they're a financially healthy organization. Or maybe it does, and we just are not smart enough lawyers to understand how that works. And this, just for context, they receive a general fund appropriation of $72 million. But mostly they've been dealing with their operating margins by reducing staff. And then a final example here is the Taiwan National Health Insurance Program. I have some information here about how their reserves are calculated, but the one interesting takeaway from this, which has like nothing to do with what's on the slide, but I wanted to leave you with because it kind of crystallized for me as I was writing the chapter, is that Taiwan had to make some reforms to address behavior changes among Taiwanese nationals. So in Taiwan, there's a tax collected to fund this program, and the healthcare is very affordable, very high quality. Well, for a number of years, there were an increasing number of Taiwanese nationals who were living out of the country, so therefore not contributing to the tax, but traveling back to Taiwan to access expensive healthcare because it was higher quality and more affordable to them than the healthcare that was available where they were living. The two places that were mentioned were the United States and China. And so the program started to struggle financially, and there were some major reforms. I believe it was either both a requirement to live in Taiwan for a number of months before you can access care, as well as a requirement to pay some sort of reduced premium if you're living out of country. And this, I think, is just important given the mobility across state lines, especially when you think about like the Vancouver area and how many people work in Portland. Just something that I wanted to mention. I'm not sure if anybody on the operations committee is thinking about those kind of lessons learned. And that is what I have. So I have a little bit more research to do on the CCOs and other nonprofit insurance. Is there anything else that you would like us to include in the chapter that we're drafting right now for you on this topic? Or any other questions? Jeff?
Not a question, but will this report be available on the website? The one that you presented today?
Oh, I don't know that. Mimi, do you know?
Oh, your this presentation and then also the memo that's coming along with it. Yes. Yes.
Okay,
And
thank
remember,
you.
and yeah, there tends to be a couple days delay for getting things
Yes.
posted. So just so you know, thank you.
Thank you.
Richard?
It seems that the most predictable financial requirement would be reserves, that we could do it as a percentage of revenue or a percentage of claims paid. Because we would be acting like an insurance company. So, I mean, I don't expect the dollar amount, but it would be helpful to have a firm number on the percentage for ongoing reserves for operations. Thank you.
Yeah. Yeah, I think I was just texting with Morgan about some of the ongoing cost numbers, and I think we could, I was thinking that Medicaid, that North Carolina Medicaid fund is like 1 month, so whatever 1/12 is. But yeah, we can definitely include that. Charlie?
So who is looking into trying to estimate the cost of the IT portion of the technology that we're going to need for this? And so I would like to, I guess, learn more about that, or find out who it is that's looking at that and what they come up with. And then what would be a typical expectation of, say, a state bond to fund that, and what kind of interest rate and yearly charges to pay that back could we expect? I guess those would be some of the kinds of questions that I would like this be explored.
And I'll just chime in there, Charlie, not to your second point, but to your first point that Milliman is looking into the startup cost of IT. But we can definitely delve deeper into the expectations of a state bond.
The one last thing I'll leave you all with is that I don't have a slide on it because it was already too long, but the preschool for all tax and the high income personal income tax in Multnomah County was intentionally pre-collected while the program ramped up. They have gotten into, I won't comment on like the political aspect of it, but it is there's precedent for that. Also in Washington, at least, the PFML tax was collected for 1 year prior to deploying benefits, in part because people had to pay the tax for 1 year before they could collect the benefits. So those are just 2 examples of if own source revenue is considered for this aspect, there's precedent in state government. Thank you all. It was nice to see you again.
Thank you.
Bye-bye.
Thank you, Sarah.
So now we move to Morgan. Take it away.
All right.
And I'll just say, Morgan, we have you built into kind of part 1 and part 2. So when you find kind of a natural, 10:30-ish for a little break, but whenever you find
I think I can find a natural spot here. All right.
Awesome,
Thank you, everybody. And again, thanks to Charlie and Richard for all their help since the board meeting to kind of help us kind of level set and keep a productive conversation. Great. So I think 2 things we're trying to do is just level set. I think we've been through the last couple months of having a straw proposal, having it go to the board, get some direction, come back, make some quick changes, and then go back to the board, get some other direction. And so it'd be good to kind of like exhale, take our breath, and then figure out what we need to do. So I would say we're still in this sort of spot, right, where we're trying to really get the structural parts right. There are 2 moving pieces that we don't need to get into today. Obviously, there's the cost target, the total cost of the plan cost, and then what our cost target is and how does our revenue proposal sync with this. But then there's also a timing question. We're still working on that in terms of like, well, what's ours right now? We try to keep everything consistent with this work from Optimus, right? We're working in 2022 data, but eventually we want to kind of say like, if the plan is the first year of taxes in 2031 or 32, we'll want to kind of get those estimates so that they line up with the cost pieces. We can ignore those for time being because we're still talking about the structure and working in the 2022 side of it. So I don't want to spend too much time on this piece, but I would say the broad maneuvers we've been thinking about, and Charlie, Mary Lou, Jeff's, everybody's points around FNR's role. We'll hold that for Cheryl and Mimi to kind of work out the specifics. But I would say the general maneuvers, at least on the structural side, is to try to get something to the board that feels right from this committee for February, basically. And so if we're working back from that, that means January. The idea would be to kind of say, well, what's our best available plan, right? So thinking about how much revenue we need to raise, so kind of squaring that with Milliman's work, and then how does that reflect it with our structure and what all the parameters need to be. That means today what we're trying to do then is, let's move off to the side the things we've already decided. Let's touch up on the things I would call them kind of little loose ends where we haven't really talked about them too much, but we probably need some closure on them. And then also try to reach consensus on some direction on, I would call, the remaining kind of policy questions that we've been talking about. Great. So I divided those things up into 3 categories. So these are things that feel like they've been locked down. Category B, it's like, well, some things have moved and probably worth, bringing them to light for the rest of everybody here so that we kind of close the loop on them. And then I think the last things are those pieces. So what can we kind of, I would say, feel like we're pretty good on? And I think the first one is this idea of a separate per person premium that we've had initially in the straw proposal and went to the board, and the board said, we don't know if we like this. We came back and said, great, that's good feedback. What we're really trying to do is adjust for the fact that households with more people should probably be paying more. We're trying to undo the way the natural effect of the income taxes, where the more exemptions you have, your relative liability goes down. And what we're really trying to do is try to kind of undo that a little bit. And then also the big question people talked about here is about Medicare Part B. Can we find a way to make sure that those folks are credited and aren't sort of taxed twice for those pieces? And so those 2 elements went to the board, and they said, great, we like the idea of getting away from a separate sort of tax called the PPP. Let's integrate that as part of your healthcare personal income tax as an adjustment. And also they felt great about offering kind of 100% Medicare Part B credit. And so those are, I would say, things that we've been working on over the last month that went to the board a couple weeks ago that I feel settled. Go ahead, Charlie.
So I would say another way we should talk about the family size rate readjustment, and I think it should probably be in our memo, is that it is one of the things that is in the plan is that the lowest amount of income is exempt from taxes. And then there's a tax rate on income above that. Some people would argue that eventually the tax rate on all income should actually go up to the marginal rate, so that it's one of the ways to think about the family size rate readjustment is that it is making up for the fact that there is an exemption on the lowest income, and we're trying to get the overall tax rate back up to something closer to what we would expect. So it's just sort of a different way of framing why we have that. I think that could be useful, or maybe not an additional way of framing why we have that. One of the things that still could be changed is, right now we're phasing it in completely over an federal poverty level amount of income that is twice where it begins to phase in. It could actually be phased in for a longer amount of federal poverty level income levels. And if in doing so over a longer amount, the rate could be smaller, or it could get us up to higher levels eventually. So I mean, that's still a possible refinement we could look at. I'm not sure if we really want to, but I just wanted to bring up that as a possibility. So.
Right. Did you guys still see my deck? I'm like, PowerPoint's doing weird things. Okay, great. I'll ignore it.
No,
Hey, Morgan, now
All
we
right.
see it. Okay.
I don't know. Sorry. Oh. Yeah, sorry. I'll hold Charlie's comment, because what the board did ask us to do is like come back with a proposal for how we should think about the structure of that. So I think Charlie, hold those ideas in as we kind of get into the last piece, because I think those are important. Is basically, how you phase it in and what the level is, and actually how does it work with the other things like the soft cap and pieces in terms of trying to be revenue neutral. I think those are important pieces. Mary Lou.
I was just going to say, Charlie, thank you for trying to explain something that I totally lost you on. But anyway, so if it's going to come later or whatever, but you confused me. So that's all.
Yeah. So I think it's important to kind of get this. So when we had the per person premium initially, I think, and not everybody, but the way we were thinking about it is like, hey, we should have this kind of like per person sort of like almost like a head tax, to say that, as your household gets bigger, you should contribute. But I think as we started looking at it and trying to sort of adjust it, if you just look in a world where you look at your tax liability per income, right? It relatively goes down by the number of exemptions you can claim, because that's federal and state tax policy, just to simply, give you, if you have a larger household, to lower your tax liability. And so what the family, and I'll just say, I might be flipping between both family size rate readjustment and household size rate readjustment. But that idea, I think what Charlie's saying, is to say, well, what we're trying to do is just get your tax liability back up to what it would be if we didn't have this sort of exemption policy, right, that is driving your tax liability down as your household gets bigger, right? As opposed to this, I mean, I think both things are true. We are trying to adjust the fact to give more spending by the size, but what we're really trying to do is the fact is really correct for the existing structure of the income tax that gives that lower liability as your household gets bigger, right? And we're really just trying to say is let's just raise it so it's basically what it would be otherwise if you didn't have to claim those exemptions.
Okay, thank you.
Richard.
Yeah, I think that's confusing. I think we're talking about two different concepts. One is we exempt the first 200 FPL of income because we don't tax people at the lower incomes. And a second concept entirely is the bigger the family, the more you pay, and it kicks in. So I think it's simpler to explain of two different concepts than trying to say you're trying to make it up. I don't think that works well with most people. That's my opinion.
Yeah, Richard, I think that's a fair simplification around the technical side of things. Yep. Thank you. Great. So any questions? I feel like these are kind of boiled in. We feel pretty good about them. I would say raise your hand, speak now if you're. We'll talk about the structure of the FSRR in a little bit, but at least in terms of how we structured it here, these feel good. I'll pause. Great. I see no hands up. Let's move on. Okay. The next two things, the next big bucket is things that, loose ends and change parameters. And I think we can take a couple of these pretty quickly. We haven't talked about the lodging tax, but we have a small incremental rate increase in the statewide lodging tax to provide a nexus to visitors who may be accessing the system, right, need care. So there's administrative cost on the system to sort of figure out payments and all that pieces. I would say it's not clear exactly what the right number is, what that actual cost is right now. And so we have sort of a sort of small increase there that provides some level of funding there. I think will be as the plan gets clearer and we have a better sort of sense, we'll just want to make sure we kind of come back to the rate to kind of square those things up. But I think from a structural and policy point of view, I think everybody feels, want to make sure we revisit that we want to retain the lodging tax in the plan for this nexus issue. So I'll just pause. Are we good with that? Great. The second piece is the committee has chosen not to include the sales tax. And I want to make sure we kind of come back and button that up but I think analytically, at least in our report, you guys said, let's just keep it there. So the board can see like, well, here's what we think the sales tax base might be and what the rate would be, but that's not part of your proposal. But I just want to make sure to confirm our past conversations there. Great. Thumbs up. Appreciate it. The last one, or sorry, not last one. The next one, what we're calling the sumptuary or like vice taxes, that we basically a set of taxes on beer, wine, tobacco, marijuana. We potentially talked about sugary beverages or other kinds of similar kind of categories. Some of these taxes are currently in place in the state of Oregon. Some of them are not, like the sugary beverages. And the question here, I think, right now we have them in there as sort of small marginal rate increases. They generate some revenue, but not, like, I would say, a sort of a problem-solving level of, or funding level size of revenues. And I think the question I want to call here is, to what extent do we want to kind of keep those in place or take them out? I don't know, but looking for guidance on the committee's thinking currently. Charlie. Oh, you're on mute.
I think that the rates, my understanding is from the way it was put into there, the rates that I have chosen to model basically do not raise any new revenue. They're the same rates as existing now, but I'm not positive if that's the case. But my feeling is that we should not count on any revenue from sumptuary taxes.
Yeah, I think that's correct. I don't think we're kind of using the status quo, at least in our revenue modeling right now, because I think everybody, the last meeting we talked deeply about this. There was some skepticism whether or not the juice juice was worth the squeeze, but we want to make sure we kind of come back with we can always keep them in there in the sense of, like we're doing with the sales tax. Like, we looked at this stuff. Here's the reasons why. Here's the revenue you might be able to get from this, but maybe not part of your core proposal. So, I think Mary Lou.
I was saying that, coming from a public health background, I'm a strong proponent of all of these different taxes because they decrease utilization from populations that end up having bad things happen because they use the things. So I'm totally for the concept, but I am not for doing it here. I think it just brings up too many. We're going to have a lot of folks that are going to have concerns about issues, and I don't think we need to bring up all of these industries too.
Thank you, Mary Lou. Richard.
Yeah, I agree. I don't think we should have the vice taxes as supporting healthcare, just not worth it. I also think that the sales tax will come back. I think that economists have pointed out that you can't run big state programs on property tax and income taxes. You just max out. And I think we're really high on the income tax and a high income tax state, and we're going to really increase income tax for medium and high earners. And I think that we're going to have to come back to a sales tax. But again, it's not my call. I know that the committee has said no sales tax, but I think we need to keep that in front of the board as number 2 does. Thank you.
Thank you, Richard. Jeff, I saw your hand up.
Yeah, I'm just going to have to get a sign out that says I agree with Charlie and Mary Lou.
All right. Well, I'll pause. Anybody else want to make a strong case for including them?
Hey, Morgan, I just wanted to agree with Richard. I would say, just like sumptuary taxes, we need to at least acknowledge that we considered sales tax, and it may need to be considered in the future.
Okay.
I agree.
We'll put it in our the section of showing our work, but not part of your proposal. Great. So the last one I want to cover here on the things that are some relative to kind of what was in our straw proposal. So our straw proposal originally had two things with the structure of the EPT. The first one was call it a small business carve out. So basically, at what point do we not tax wages of small firms, right? Measured as by the size of their payroll. The second structural piece was, I would think of it as like a standard deduction. I think we had it at I can't remember if it was 100 or 140% of federal poverty level, where basically think of it as the phase in where if you were really making really low wages, those wages wouldn't be subject to the full rate of the EPT, but that would phase in. Some of the feedback and conversation we've had here, I think Charlie and Richard thought, like, well, we're trying to avoid fiscal cliffs. We don't want to create incentives for businesses at the margins, right, to keep wages relatively low and minimize their exposure to the EPT tax. So let's remove that standard deduction and just make basically all wages are subject to the payroll tax. I believe we decided to say, well, let's keep the current small business exemption level at 500,000, but that could be a change. But these two things are kind of small things that have been kind of happening in the revision since the proposal went to the overall board. But we want to just make sure we kind of come back and reflect those kind of two pieces of discussion in terms of how we're structuring that tax right now. Charlie, do you want to add anything? Right, perfect.
No, I would just say that I think we should go with this. I think we should go with there being no individual wage deduction, and that what we should bring to the board is the 500,000 firm payroll exemption. So I would say we should do this.
Yes.
All right, Mary Lou, I would say my sense is there's probably consensus. Does anybody have an objection or a part of discussion or consideration that we should be talking about on that piece? Great. Mimi and Cheryl, I think now we probably have a good point to take a little bit of a break before we dive into the kind of meaty part of talking about the tax credit level, soft cap, the structure and shape of the family size rate readjustment factor, and then a topic that was raised here, but and also at the board around this personal ownership. Do we want to take a short break now, and we'll reconvene for the kind of category C elements?
Sure. Let's come back at 10:40.
Okay.
Thanks.
Great.
Morgan, just a
Yep.
question for you.
Certainly.
We've talked about early on in the last couple of meetings, or at least I've talked about, and the group agreed about being able to get a one-page summary of revenues and expenses and a one-page summary of before and after. Is that still in the works?
Yes. We have that
Stop. We're good.
We're good. Yes,
Okay.
yeah, I think once we kind of hit a good stop point, we'll get all those things lined up for you.
Okay, thank you.
Yep.
Hi all. If you can turn on your cameras so we know you're back and we can continue. Well, Morgan, let's get started. Hopefully others will join us very soon. So take it away.
Weird. Sorry, it's telling me it won't start my screen share. Let's try this again. All right, here we go. Okay, so let's take the four, I would say, items that are still being refined. And I think here, to the extent that if we can find consensus on things, then it would be great to decide them. But I would say the minimum here we're trying to accomplish is to try to, one, make sure we're all understanding kind of what the structure is and why it's there. And part of it here, there are plurality of views that one can bring to a lot of these different things. And so let's make sure we kind of air those pieces. But in the end, I think what we're trying to do is trying to find direction, both kind of conceptually, structurally, or even if it's like, well, maybe we can't all agree. And so maybe we need to have kind of what should be in the proposal and then kind of what should be also like we're showing our work, as a sort of other information that should be forwarded to the board. So we'll take these, I think, in maybe order of complexity as well as maybe areas where we have more agreement than less. But the first one is the level of the EPT tax credit, the soft cap mechanism, the family size rate readjustment, and then the personal ownership piece. And we all get into all of these here a little bit. So let's start with the EPT tax credit. So the direction we received back from the board was, yes, we like the fact that you have this EPT in there as a way for business to contribute. We like that from your last meeting was like, it shouldn't be 0 and it shouldn't be 100, but somewhere in between. And so the board says, can you come back and derive a way for us to bring forward a recommendation to what's the right appropriate amount? And so maybe a way to start thinking about this, and I'll just move quickly because I want to get to the conversation here, is right to the extent that we're offering a credit, right? That's a tax expenditure. So we're spending that money on something, right? And in that case, right, it's spending in the tax code. And what we're spending it on is really thinking of it as sort of buying down the liability of workers whose firms are making that purchase, right? Because if we didn't do that spending in the tax code, we could offer a slightly lower rate. And so that's all this chart is doing is making sure, well, one, it's telling you what we're testing here a little bit, the key parameters. But the other key piece here, if you look at the sort of the relationship of the credit relative to the rate, right? There's a sort of inverse relationship. And so maybe we're worth back kind of starting here with, I would call them kind of maybe straw or steelman arguments of kind of why we have the credit, right? And where we need judgment. So the reason why we have the credit, right, is this idea here, we're trying to avoid the pyramiding of taxation, right? So the same dollar of worker compensation, whether, and this, I think, Mary Lou, I'll channel you, is basically saying, hey, well, maybe that compensation doesn't change, right? Maybe their hiring doesn't change, right? I think there are, the complexity there is pretty large, and we don't need to get into that. But the idea of why you would do it, right, is to avoid the sort of double taxation of the compensation. And the reason you'd offer the credit in the way we're trying to offer it is particularly to protect those at the low and middle income workers the most, since they are the ones that benefit most from that credit. And then also, right, because we're not trying to tax those things, we're just trying to say, hey, well, let's just keep labor markets fairly neutral because, firms are already offering ESI payments. Let's just offer them that. That way we don't mess around with how people think about net compensation perspective. And then also when we do the credit, right, we can kind of adjust sort of how our people who work self-employed versus those who are employed contribute to the overall plan. And so I'll get to Charlie real quick. So I think to me, like there are 3 questions, right, around sort of like, well, the credits, right, reduce progressivity at the top. So to the extent that you offer less of a credit, right, it changes the compensation. Obviously, the more that we offer credits, right, it reduces sort of the net revenue going into the plan from EPT. And there's obviously this tension between wage earners and non-wage earners because only the wage earners are the ones getting the credit. Go ahead, Charlie.
Go back to the previous
Yep.
slide. Yeah, thanks. So the maintain efficiency and neutrality, I would say it's really more related to maintaining or creating less of an abrupt change to the way that the current system affects workers. So I'm not sure it's efficiency and neutrality. It's just a smaller change to what the effect on workers. So I will add to this. So I've done some distribution analysis, and the lower the EPT credit, I should say the other way around. The higher the EPT credit, the more the top quintile is burdened. So there's it's not a big change, but the EPT credit, the higher it is, the more progressive the tax structure is overall. And that's essentially because the highest earners have a greater share of income that's not wages than most of the, and it doesn't really affect the lowest 40%, but the 60 to 80 or the third, so the 40 to 80 percentile wage, or not wage earners, just overall AGI groups will benefit from having a higher EPT credit, and the top 20% will have greater taxes if there's a higher EPT credit. So just wanted to throw that in there as well.
Yeah, no, I think it's good. I think it may be a good segue to kind of the way I think about this is like we're working on two ends. If the simplest way to think about this is two ends of the spectrum, right? What happens if we set it really high? When we set it really high, like 100% credit, right? It basically ensures like a lot of high income workers, you know, s- you sorry, sorry, uh, sorry. When we so we sorry, I may have got my own sort of thinking around here mixed up. So why set it at zero, right? So if we set the zero, basically it says all healthcare spending, right? It's just purely shifting, and then we're moving kind of the burden to employees, right? We're just saying like, hey, we're the firms are paying for the EPT, and that then the remaining liability is really on our workers, right? And so it maintains the continuity, it avoids this sort of double taxing. And when we say not why not 100%, right? We're basically saying, well, we actually want to sort of preserve sort of the progressivity. So I think go back to Charlie's point here, to the extent that we are offering a um, uh, relatively higher credit, we can ensure that the distribution, like the credit, then effectively offsets a lot of the liability at lower income households while still preserving the relative, even though high-end workers are still getting that credit, the relative liability is still being pushed higher and higher up the income spectrum. And I think maybe without trying to say this in words here, let's kind of go to the charts a little bit. And so these are some very useful charts that Charlie put together that show, and I have them for 1, 2, 3, and 4 exemption households. So you can just see how that relatively changes. And then have it across those different plans where we have E is the highest in terms of the 60% EPT, A is 50, B 40, C 30, and D is no EPT. And so I think a simple way to understand this is to kind of read the chart from left to right. And so on the left-hand side, right, with respect to employees, we want to see basically more green moving, kind of think of it as basically from uh, upwards, right? We want to see basically as we kind of go from 60 to 0, that green line, right, is getting small. That's the number of folks in the employee comment are getting smaller and smaller. Because what that's telling us here is that a higher credit, right, is offsetting the liability, right, and particularly for folks with one exemption, right, those are a lot of returns and about a quarter of the people. So we can kind of see here for folks in that one exemption category, the 76 percentile are earners between 60 to 70 AGI. So you're getting a lot of those folks, and the remaining folks are paying slightly more above that threshold. And you can kind of see then we hold that same structure as we kind of go from to the 2, 3, and 4. So basically, as you move left to right, the credit has a sort of effect of reducing the liability in those households. And then the second way to understand these charts is to look at them from a parity perspective, from between comparisons between employees and self-employed. And what you see, right, is that the 60 percentile is greater parity between those who are earning their income in wages versus those who are self-employed. And as you sort of get to fewer and fewer credits, right, the self-employed folks are out, there's greater disparity between the employees and the self-employed folks. And so the testing that Charlie here did is intentional because, and Charlie, you should jump in here, is that when we think about sort of the EPT, the credit, just think about just offsetting the liability of folks, wage earners across the exemption. 60% seems to be the threshold where we get greater numbers of individuals at the lower incomes reducing their liability. So we see, sort of call it, more progressivity there. But it's also the place where we see better parity between how the credit is treating employed people versus self-employed folks. So I think the point of all the question around, well, if we're going to have an EPT credit, what level should we set it at? And this is separate from, I think, Mary Lou, your question, should we have the credit at all? But if we're going to have the credit, Charlie's testing here seems to suggest that 60% might be the sort of optimal way to think about this when you think about sort of pre-post liability and how the credit can offset the total tax liability from the healthcare personal income tax, particularly in lower income households, which make up a vast majority of all returns and filers. Charlie, anything else you want to add to that before Mary Lou's question?
No, I will have something else I wanted to say about something else that we should be exploring, but not at this point.
Okay, great. Mary Lou.
Hang on. Can you go back to that first slide? Back.
Oh, back.
It was a chart there.
Yeah.
Okay, this one. Okay, as I've looked at this and actually gotten some input from people, I think the issue that will make this either easier or harder to sell, honestly, is the second line, the personal income tax rate. And as you can see that, and he doesn't show 60%, or you don't show 60 on here, but it starts decreasing.
Column E is 60%.
Yeah.
Pardon?
Column E.
Yeah.
Oh, thank you.
Yeah.
It's okay. I was reading. Okay, sorry. Thank you. Reading down. So column E shows that we'd have to have a personal income tax at 10.66. I don't know if I'm kind of one of these people that is, been convinced that when you go to the store that, $29.99 is better than $30. There's lots of marketing people that have done all kinds of stuff around these kinds of issues. All I know is that I personally really would like that number to be less than 10%. I don't know why it just kind of like, okay, when you're talking 10%, that sounds quite a bit, and you're getting all kinds of great benefits. I mean, I can sell, igloos in Alaska sometimes, but anyway, so that's why I am not as much favor for the 60% for sure. I tend to be, I really like the 30, but that may not be okay with others. So I'm okay with 40. But I don't like it going over 10. Thank you.
Yeah, no, thank you, Mary Lou. Any other feedback or discussion here? I think Mary Lou's point is, well taken. I think, just the sticker shock is a real thing we should be paying attention to. But I think what we're trying to do with these charts is to supplement it, right? Because it's not just the rate, it's the base, what is getting taxed changes relative to the credits that we're offering folks. And so, I think this is a harder thing, for everybody to kind of wrap their mind around, right? Is basically, oh, well, maybe a higher rate, but because of all the net credits, right, I'm paying zero. And that's true today in their own income tax, right? It's like, it's a high rate, but like all the deductions and credits reduce your effective liability to, for many folks, to close to zero. So
I agree.
So I think we want to make sure we kind of, from a messaging perspective, and I think I think all to say is like, that's kind of what we're trying to get at with the credit itself. Sure, the rate has to be higher on everybody else because we're offering this credit that extremely benefits folks at the lower end of the AGI spectrum. Go ahead, Charlie.
So one of the things I think we need to remember is that once we get to the point of saying we're going to actually have to fund the whatever borrowing we do for the startup costs, the reserve funds, et cetera. So the tax rate is almost surely going to have to be higher than what we're looking at right now. And so we don't know where that 10 will land. So I would put forward that at this point, I'll make a proposal. At this point, the committee thinks that the EPT credit should be somewhere between 30% and 60%. And that's what we are going to say to the board. And we don't know until we find out more information and do some more exploring what exactly it should be. So that'd be one point. The other point that I would make is I think it's going to be worthwhile to explore phasing out the EPT credit at higher incomes, because besides the green and red here are comparisons between what sort of a guess as to what the status quo is relative to what the UHP. We know what the UHP will cost.
Well educated guess. Well educated guess.
Figuring out what the status quo costs is a much harder task, and so these are a reasonable estimate of. I mean, the numbers there are the difference between status quo minus what the UHP will be, and so if it's a positive number, the UHP is going to save you money. When you look at just the raw numbers, how much are you going to have to pay? The self-employed people are going to have to pay noticeably more than those who are employed because or at least those who are getting the EPT credit. At higher incomes, maybe we shouldn't have that disparity anymore. So maybe we should phase out the EPT credit so they're paying the same amount. That to me is something that we should explore. It's going to take a little bit of time to do so, but I think it's worth mentioning that that's something we're going to be looking at.
Sounds good.
That's fantastic, Charlie. Richard's giving a thumbs up. Other feedback here, thank you, Mary Lou. What I think Charlie just said here is like, yes, like it's hard to be precise exactly here with the right level. And I think what Charlie just said is like, let's keep a range here in the middle that seems to, at least the preliminary testing seems to indicate we're on the right path. And then, but I also like Charlie's idea around the phase out because I think that will help sort of provide more parity, particularly at the higher incomes, and also maybe also address some of your rate questions, Mary Lou. So. Great. Any other conversation? But I would say to me that is the takeaway on the next steps here for the month on the EPT credit is just to do a little more testing. But I think hopefully folks feel comfortable with the direction that we're headed. If not, please raise your hand here and provide some feedback and direction that we can incorporate there. Richard.
For simplicity for the board's consumption, should we go ahead and eliminate columns on either extreme? And say offer 30, 45, and 60, just to simplify the choices. Just a suggestion.
Yeah, I think as you know, we're kind of doing the testing some of the bookends, we can kind of narrow into kind of what we think the best path is. We'll document kind of what the path that we've done, but I think in terms of our communications internally here and with the board, more simplification is useful.
Good.
Cheryl.
I was first going to agree, but I have to say when you explained the chart, I had a hard time digesting it on my own, but when you explained the chart and I could see the differences between all the columns, that made a lot of sense to me too. So I have kind of two different opinions about that.
And which way did it argue for you, Cheryl? How, when you saw the difference in the columns, what turned out?
Really helped me, I mean, just really simplistically, because this is not my area of expertise, but just seeing the differences in the green and red, to see, to me, that made sense to me that in the 60% column, it was more equal between the employee and the self-employed, until you get to the red, of course, but, and you could see the differences in the other columns where it was favoring self-employed versus employed. I could see that very, very clearly. So
go ahead, Charlie.
So to me, I think we could present it with all of these, or we could do just 30, 45, and 60. I think either of those is a reasonable choice to make. A reason for keeping the 0 is because it's strikingly different, but
yeah.
I think that could be done. The other thing I think that's going to be worth presenting is the quintile distribution of the overall tax structure, and for at least for the 30 and the 60, so that can be shown. and people can see, yeah, it's a little bit different, but not very much.
Yep. All right. Thank you, Charlie. Go ahead, Mary Lou.
I think the thing I keep wanting to do is be sure that the feedback that we have gotten about, kind of the middle and upper ends of that, especially at the upper end, people need to be paying, bearing quite a bit of this burden, and that keeping it lower for the middle and lower incomes. And I think that's what I think everybody's trying to do here. And like you say, if you got a lower overall rate, my less than 10%, to be just, something specific here, what does that do? And oh, my watch talked to me. I'm sorry. Then, so it's like, I keep telling people it's a Rubik's Cube. And that it is, you move that dial and all of a sudden, oh, the yellows are out of whack here. And this is very complicated. And I really thank the brain that Charlie had to start doing this and get us to where we are, and the other people then that have added in. I think, Morgan, you've been really good about helping to really push us to, okay, but Charlie's given us lots of options. And so which ones are we going to land on? And so anyway, I don't know. I just feel the need to say thank you, and that recognize how difficult this is. And I hope other people who are listening in, and we're all getting feedback on, keep it simple, make it do this, do that, that, it is not simple because of the current way taxes are, because a lot of the things that are built in that kind of behind the screen, most people I know use TurboTax. They put in numbers and out it spits at the end, and they hold their breath and hope that they will get a refund. And that's kind of how it is. And so to kind of go into this kind of specificity, and because there are things that are already built in that we're having to deal with and counteract or whatever, and to make this as progressive as possible. And I just want to say to people who are listening, who are advocates, who are really caring about this, that this committee really is considering that and really is caring, and that sometimes the trade-offs, we'll just have to decide which is the better or slightly worse. So thank you all for doing this incredible work.
Well, thank you, Mary Lou, and big thanks to Charlie. Go ahead, Richard.
The committee has received a lot of feedback about progressivity. Charlie, can you make a statement, not to put you on the spot, but I will ask, please, can you make a statement about progressivity of the overall plans, either whether it's A, B, C, D, or E, about progressivity? Because I believe every one of them is progressive, that higher incomes pay a greater percentage of their income to the healthcare personal income tax.
Yeah, I mean, so right now the design, we'll talk about the soft cap a little bit later, but without the soft cap, all of the tax structures are progressive through all of the range of income. And the higher the EPT credit, the greater the progressivity, but it doesn't change too much. It changes a little bit. But I'll just stop there, and we'll get back to talking more about this when we talk about soft cap.
Yeah, well, I think it's a good segue, actually, because the soft cap. Oh, go ahead, Jeff. Oh, you're on mute.
Ah, gun it. If I hope I never hear the words "you're on mute" again.
You might be
Anyway,
out of luck.
yeah, I know. As Mary Lou pointed out, there are trade-offs in every decision recommendation that's made. Do you have, or does the team have, an estimate of the trade-offs of how many people may decide to leave Oregon because of the increase in taxes? I'm not saying everyone's going to do it. I'm not saying no one's going to do it, but some people do. And therefore will have an impact on the revenue. Is that factor built in at all?
Charlie, jump in here, but I would say no, we're not looking, we don't have a specific elasticity of this marginal tax liability will lead to this many people leaving, therefore the effect on the revenue is, Y or whatever it might be. I think that is true in a sort of broad sense, right? You can think of it at the
Right.
extremes. And then the question here is really, how do we accommodate for that? And I think, right, this is the soft cap question. And Jeff, I'll just kind of start segueing this because I think it's a good way to start thinking about this, because I think what Charlie just said here is like, the soft cap is the place where ultimately we really have the greatest influence on the rate of progressivity, I think, relative to Richard's question. Because all of them, if you thought about just the healthcare personal income tax with some version of the family size or household size rate readjustment factor, are all pretty darn progressive relative to what people pay today. And I think that's a good way to sort of think about it. Like, our tax structure today is already pretty progressive with respect to the federal and state income tax because of the way the various sort of marginal rates and or deductions and exemptions work. And the question, I think, for this group, right, is when we layer on this new sort of funding to pay for healthcare, to what extent do we want to make that more or less progressive to the status quo? And so this chart here, I think, is a great one that Charlie passed along from Warren George, just looking at the current distribution of paying for healthcare across, the various state, federal funding sources relative to the income quintiles. And right, and I think this mirrors a lot of what you see just generally with sort of tax contributions. That the vast majority of total tax paid is paid by the top quintile because our structure is fairly progressive. And then our ability to influence this, right? The sort of how we structure the EPT, whether or not there's a phase out at higher incomes will change that picture. But the way we really have been controlling for this is through the soft cap mechanism, because we don't have a sort of like progressively higher marginal rate table, like the way the federal structure kind of caps out. I can't remember where we're at now, 35% or whatever it is, the top marginal rate. You could go to something like that, but where we've gone to something here is more simple, and more in line with the Oregon way, the way the state of Oregon does its income taxes. So I think the soft cap decision, right, is really about how much to it, or we're sort of really modifying this contribution pattern. Go ahead, Charlie.
So I want to say a couple things. So one is that without the soft cap, it is not just relatively progressive compared to what currently exists. It's by definition progressive by any measure you make. So it's not just relatively progressive. With the soft cap, it wouldn't be progressive. It would only be relatively progressive. And so the other comment I would like to make at this point is if you actually look at the income distribution in Oregon, it is almost the same as this distribution from Warren George's plot. And so it is not that this does not, I mean, it sort of makes it look almost like the current contributions are somewhat progressive, but in fact, they're not. They are essentially almost flat. Yeah. And the only reason that they're almost flat is because a huge amount of healthcare is funded by federal government income taxes. So Medicare and Medicaid form because they're funded primarily by federal income taxes, which are progressive, the overall structure becomes almost flat. The part that we are going to be essentially transforming is the part that is extraordinarily flat right now, or it is regressive right now. And so that is the cash contributions, or the out-of-pocket, and the private health insurance. And so those are the parts that are very much not progressive at this point. So I'll stop there.
No, I'll do a quick summary because I think it's really important you to kind of weigh the two dimensions of this. And I would say progressivity, right, is very simple. It's like, what is the ability to pay? Like, what is your contribution relative to your income? And and that we want that in a progressive system, right, that rises. The more income you have, a greater set of liability relative to that income. That is separate from, I would call it a taxpayer perspective, right? Is basically where does all the money come from, right? And so here, right, you could have, I think what Charlie said is a fairly flat system, but that still is sort of generating where the folks at the highest end of are still the ones paying for the majority of that system. So there are two separate ideas that you can measure two different ways, right? Where is all the money coming from is the total liability, and then what is it as a percent of your total income? So, and progressivity was really specific to sort of like, what is sort of your the total liability relative to the income. So, to do that, Charlie put together some different scenarios here. So for just to try to keep things from moving around too much, we just fixed the EPT credit at 60% so that we could look at different levels of when the soft cap kicks in and what the relative rate would be. And so to focus in on column E, that's basically, you can see basically it says soft cap starts at 40, but the rate is still the same. So that's really kind of our no soft cap scenario. And then all the other scenarios are looking at different levels, kind of like when does the phase in start, and then what is the rate after that. Go ahead, Charlie.
So I would like to actually maybe sort of stop this conversation to looking at it in detail. We've gotten a lot of feedback that people really don't like the soft cap. And to me, I think we should relegate the soft cap to where we've relegated the sales tax. And that is that it is something that we could later consider, but we're not proposing it to the board at this point. So, to Jeff's question, I think we have no idea whatsoever what how many people will leave or do other things to avoid the taxes. At how many high income people will leave or do something to avoid the taxes. We've gotten, again, public input that said history would show almost nobody will do that. I'm not sure I necessarily buy that, but I do think that the details of the soft cap, it doesn't really matter which one you choose. They are not very much different unless you choose one that has a soft cap that it's barely a soft, it's really almost the same percentage. So I don't think we should be using our time today to look into it. I think we should really relegate it more to the sales tax portion. I'll stop there and see what other people have to think about that.
Yeah, go ahead, Richard.
Can I share just one slide?
Yeah.
I'd like to have these great charts that Charlie made as part of the deck to the board and
This one
for
here?
the public.
Is the one here, Richard?
The graph I'm looking
Yeah.
at. The point of the graph is if the line is sloping upwards from left to right, it's progressive. And so for the public and for the board, you can see that it is progressive. Across they all look similar to this, but the point, I think this is an important one to have for the board and for the public to show that all these plans are progressive. Thank you.
Go ahead, Mary Lou. Sorry, I can come back to this one a little bit, Richard, but go ahead, Mary Lou, then Jeff, then Charlie.
I think I was just agreeing with Charlie about the input, et cetera, around the soft cap. And I don't think it's going to make that big a difference at the high end in terms of people deciding they're going to up and move their families and their lives to somewhere else. And so I'm a no soft cap person.
All right, Jeff?
Yeah, I think that consistent with what we decided and discussed about the consumption taxes going off the table, at least at this point in time, and we'll note that in the report, that if we decide to remove the soft cap, we should then note that it was looked at and it was decided to be removed. And then this point, I think it was Charlie, I think you made it, or Richard, I don't remember who. I apologize for not remembering, noting that by removing the soft cap, we go from relatively progressive to highly progressive. And that then should also then be included in the report.
So Jeff, are you agreeing with Charlie and Mary Lou that as your core proposal to remove the soft cap, and then we can kind of keep it as shore work categories?
I think I would rather leave the soft cap in because I am a believer, Morgan, to use your words, elasticity. And therefore, by not having the soft cap in, we increases the chances of having less revenue. But if the group here votes to remove the soft cap, okay, that's the recommendation that goes forward.
Yep. Okay. Thanks, Jeff. Charlie, and then Cheryl.
So I think that this we should have a vote on the notion of remove the soft cap and have it as a show your work piece, or leave it in. I think that's worth a vote of the committee. I would also say I would like to go back to this slide that you showed of the progressivity, but go to the one without a soft cap that
This one?
that goes to hiring. So this is the one. So if the blue line, which goes up, shows that without the soft cap, it's progressive even up to the highest AGI level that the Department of Revenue reports, the 1.2 million AGI level. With a soft cap, it becomes unprogressive for everything other than the purple line, which is just sort of not a very soft cap. I mean, so it kicks in at 20K of liability, and it's the highest rate is at 8%. And so that with that, if you only go up to 1.2 million, it is progressive at all levels. But if you actually go up to 10 million, it comes down. Actually, it doesn't. It'll go up to almost 8%. So that actually remains progressive by definition at all income levels. So you could do a soft cap if it's just a tiny bit lower, but that wouldn't do anything, I don't think, to look at the moving out elasticity question. So I don't know if it's worth thinking anything more about that one. So I'll stop there.
Yeah, Cheryl.
I'm not sure if I feel ready to vote on this today, because I didn't anticipate that we would be voting on whether to have a soft cap or not. I thought we were probably going to look at, the level. So it would be helpful to me with the bar chart where it says no soft cap and soft cap, to have the income ranges and the quintiles, just to remind me like what we're looking at, or maybe in a key or something. I guess my question is it important or essential to you for us to vote on this today in order to move forward with the next steps, or can you keep it in as an option and we could look at both of those options in January?
I think at the bare minimum, what we're saying is keep it in as just keep studying this in our shore work kind of method.
Yeah.
I think maybe the question Charlie is raising is, what's the difference between not having a soft cap versus having a very soft cap, maybe? You think of it as basically, I think of it as based in this chart, right? Should we have more conversation between that purple line and the light blue no soft cap line?
So maybe that's my point. Is it possible to narrow down the possibilities and then just see them side by side to see what we're talking about and how that would shift the revenue? I mean,
let's go to Charlie real quick. He might have a feedback.
So I was wondering if it is possible. It looks like Fritz Bush might have a comment from Milliman.
Yeah,
Is it
we'll
possible
hope
to
Fritz.
bring him in and get a comment?
Yeah, Fritz, do you have something germane here before?
Yeah. Well, I hope I don't. I have a question. I don't have anything material to contribute, but I just, as a sort of as an outsider, maybe this question will be helpful, right? It just as an audience member, the first bullet says the chart shows the effective tax rate paid by the average filer. So does the graph represent the incremental rate or the marginal rate, or is it the average rate that they have paid up to, the composite rate that they have paid up to that point of income? Does my question make sense?
Yeah, so it is the actual total tax liability of a person with that income divided by their income, by their AGI. And so
Okay.
it is, basically the cumulative, I guess.
The cumulative.
Tax
Okay,
rate.
very
Yeah.
good. That
Yeah.
makes sense. Thank you.
All right. Go ahead, Charlie. Okay.
No more.
Yeah. So to my sense here is the question. If I'm trying to quickly size up, I think the desire, right, is on two sides: is to maintain a progressive structure per your principles, relative to, I think, the question that Jeff asked, right, is like we should take seriously the concern that the liability is high enough that we might be inducing high contributors to sort of avoid the tax, right? And so my question back to you all is, to what extent do you want to think about exploring that space between that light blue line and the purple line, I guess? Mary Lou, and then Charlie. Oh, Mary Lou, you're on mute.
Thank you. Sorry, Jeff, you heard the words. But I guess my thing isn't so much about, now, because I did that, my brain went crazy here. Crap. It was good until I had to do that. I'll let Charlie speak and maybe then it'll come back to me. Okay, thanks.
So to me, there's not much point in exploring that line because, suppose you have a really high income person that would be liable for $1 million in new healthcare taxes. The difference is going to be, is it $1 million or is it 1.1 or maybe 1.2? That's not going to change their mind unless it goes down to, a couple 100,000 compared to $1 million. They're not going to care much. So I just do not think that it's going to, if it continues to be progressive, I don't think it's going to matter.
Yeah, go ahead, Jeff.
I agree with the comment that it's not worth pursuing because it's a question of being vaguely right versus precisely wrong. I believe the elasticity question in this case is vaguely right. Putting a dollar on it would be, whatever number would be put on it would be wrong, but that doesn't remove the impact of elasticity.
Yep. Go ahead, Mary Lou.
Okay, I
Thanks,
guess
Jeff. I think that was well said.
okay, so I think that what I was going to say is that I think people that are at that very high income level, they don't sit down with TurboTax, okay? They have got all kinds of consultants and tax lawyers, et cetera, that help them do all kinds of things to make their tax liability as small as possible. And I don't think, I probably, if I were there, I would be doing that too. But the fact, so there's no judgment on it. I'm just saying that I don't think that this soft cap thing is a big enough deal to have all of the input from other people that feel like you've done a good job of making it really progressive, keeps going. Don't cap it off here. So I don't know, maybe it's more of a perceptional thing or, I don't know how much actually, and I think we're all guessing at things like, will people, if they do have to pay that very high tax, fly the coop? Things I've seen is that wealth is held mostly by older people. Yeah, there's some high-tech younger people but that's more in California than here, but there are probably still some of those. And they may not have the same roots, the same whatever that keeps us living where we live. So I think some of this is kind of subjective and there's been some studies, et cetera. But I guess I just overall feel that I agree with Charlie that it's, again, show the work, say we considered it, but I'm a take it away.
Okay. Cheryl, so what I think where we are with this is, and then we can be a bit soft because I think we're still analytically carrying this forward. But I think it matters in terms of kind of what our sort of, correct me if I'm wrong, Charlie, but what our kind of base case is. So to the extent that we're kind of removing the soft cap from our base case, it allows us then a little more to flexibility to sort of look at the effects of the EPT credit, just kind of limiting our sort of different sort of permutate or how many permutations we're looking at. So to me, I would say if you're going to vote, I would say to give a vote to sort of remove the soft cap from your sort of, call it your consensus proposal. And then we can then analytically keep it alive, because I think Jeff's right. It's like we need to have some of the math in there to show kind of like the idea here of like what around sort of the tax avoidance problem, and to what extent that offering something here makes it less progressive, but at the same time, reduces total liability and the implications on the revenue, right, relative to the rate. Because I think as Charlie was saying, right, this is one of those big things. If you go back for our table, right, look at different soft cap arrangements, right, you're kind of bouncing around anywhere from, 1.82 percentage points difference between like the A and the E plan with respect to sort of the no soft cap arrangement. So pretty large amount of sort of redistribution that has to happen to offset this picture, right, with respect to sort of reduce liabilities. So Cheryl, I don't know if you want to like call a question of a vote and just get that direction.
I don't know that we need a vote. I mean, I think I can go along with the majority, at least those of you who spoke want to drop the soft cap and just show our work, and that's okay. I suppose the board can always ask us questions and want us to look further or try, compare things, whatever. So that's still possible, but I'm okay with just going with those who spoke and just going forward with that that idea.
I mean, I spoke, but I'm in favor of keeping the soft cap.
Oh, okay. I'm sorry, I didn't quite get that from what you said. Okay, well, we can vote then if you would prefer to do it that way. Would you like to do that? The committee? Okay. The only problem is John will not be able to vote, even though he's listening. So I don't know what we do about that. Any ideas?
He could send an email in indicating his vote.
Or a text. I just
Or a text.
was
Yeah.
texting with him. He's on his way home.
Oh.
So I'm not sure how far he was from his appointment to home, but I mean, we might even defer it and go on a little bit.
Yeah, can we hold off and just see if John can
Yeah, I think so. I mean, because I think, Charlie, I see a path for us to continue to kind of work through this, with the kind of assumption here that it, maybe a vote passes, I might guess, if I'm just guessing. But then we can analytically keep it alive for this group and board consideration around this important issue. So, okay. Great. I'm going to speed us along through these pieces. You should definitely look at some of the stuff there. But I want to get to the last two pieces of our conversation. And remind me, right, Cheryl, we're trying to get to public comment at 11:45 or 11:50.
Well, I don't believe we have any public comment. We only got written public comment unless anything has changed that I don't know about.
I'm sorry, apologies, Mary Lou. I just wanted to jump in here, Morgan, because we did want to go over kind of the committee work plan and timeline, and then also have a chance for the committee members for a discussion about for the feedback about meeting materials and things like that. So if you could, maybe just say.
But we still need to end at 11.
10 to 15 minutes.
Yeah.
If you can give us that much time, Morgan, that'd be great.
Great.
I just was going to say, I just got a text from John. I don't know the legality of this or whatever, but he says, I vote no cap. Okay. He's on his way home.
Great. So on the family size rate readjustment piece, I guess again, I think Charlie sort of summarized this nicely, right? In the sense that a lot, depending on how the parameters shake out, right? The credit, the soft cap, we have a then solve for an actual income tax rate for the healthcare personal income tax. And part of what the family size rate readjustment is doing, right, is to sort of bring those effective tax rates, right, back up. And so all to say is, if you think about without well, I'm calling it now here the household size rate readjustment. I'll figure it out. But I think we decided it was household. So I might have stuck
Give it
family
a
in
name.
instead. Anyway, so the household size rate readjustment piece, right on the left. This is a chart we showed in our memo to the board. And I'll just remind you, right, this is what happens without that adjustment. So as you think about different incomes and different household size, your effective tax rate drops. And this is just sort of the intent of income tax policy by the consideration of the exemption, right? Is to give larger households more effective income at every income band. And so what we're saying with the household size rate readjustment, I think is, two things, right? We want this idea that households with more people, because they're consuming this good that is being provided through the universal health plan and healthcare, to also reflect that they are consuming that good and should have some contribution to it. And then I think there's Charlie's point too, is what we're also trying to do then is change that rate so that those lines effectively kind of flatten out to some degree, so that your effective tax rate from between greater than 2, right, is being adjusted, but that we can be more or less progressive at different. We can let the sort of effects of the exemption level also kind of make it a little more progressive at different levels of income, which is why you see kind of if you think about that chart on the right, it kind of flattening out initially, but then also assuming this little more sort of like lower effective rates at higher households by different income categories, except the highest income categories where you see the effect of those phase outs. Go ahead, Charlie.
So it's not well, it is partly so that why do we want a higher rate for those with large family size? And maybe part of it is the usage. They use more, so maybe they should pay more. That's actually a really very small part of it. A bigger part of it is in the current system, they pay a lot more. And with change to the universal health plan, the larger families will gain a lot more than the smaller family size, which is still going to be the case even with the readjustment. They'll still gain quite a bit more, but they won't gain quite as much more, so that the smaller families will gain less than the larger families, but it'll be closer. So it's kind of related to a change from the current system, I would say, more than it is that they should just pay more. I mean, it's some of each, but it does both things. It makes it so the larger families, there is certainly going to be a shift from large families to smaller families. That's unavoidable with the tax structure. But it is not going to be such as great a shift as it would otherwise be if you have this rate readjustment.
Okay. There was a hand up, but maybe it went down. So what I think the path forward here is, with us narrowing in on the EPT credit, now that we have the Part B credit, we're going to potentially drop from our core proposal the soft cap. It allows us then to fiddle, right? I think was the right term, Charlie, with different levels, different rate structures for the household size rate readjustment, so that we can, get different pictures of this sort of distribution. And so I think the conversation here is, I think, is everybody's comfortable with us doing something going from left to right here. As we nail down all those other parameters, we can then come back and say, well, what actually should be where the phase in is, and then what is the rate. So those bottom 2 rows on this table allows us to solve for those pieces. Go ahead, Charlie.
I mean, so the phase in is probably still a question.
Yep.
What I have done for the rate is I put it at the highest value that it can be, but still keeping the progressivity of the tax structure so that it's always a positive slope on a total tax liability versus income thing. So to me, that's where I would like to have it. And so the value is chosen to be the greatest amount of adjustment that you can have while you're still keeping the tax structure always progressive.
Yeah, I think to me, I think that they're kind of like stabilizer levelers here a little bit that kind of maintain the principles that you're seeking across the exemption spectrum and the income spectrum. So I think what Charlie said here, right, is both the phase in and the rate matter, but they're really inputs to get an outcome with respect to how the overall distribution looks. Go ahead, Richard.
Is Charlie, is the FSRR above 1 or above 2 here? Don't we charge for the second person?
Yeah, it's above 1.
Above 1, yeah.
Yeah,
Should be
above 1.
two and above is what
2 and above, right?
2 and above, yes.
Okay. Any other feedback? Does that feel like the right path? See a nod from Richard. Jeff, Mary Lou, any other feedback or Cheryl direction here outside of kind of the path that we're on there?
Yeah, could you go to that next chart? I just want to absorb what you're saying. Or the next slide, I should say, next, where you're explaining what we'd have to do if we didn't have the soft cap. I just need to absorb that.
Yes. So maybe a simple way to think about this, Cheryl, is in a lot of the progressivity in the plan, and this isn't the best way to look at it, but if you look at like the 500,000, 250, or the 200,000 above, right, your higher income bands, where a lot of the tax is being generated, but also where shapes how progressive the structure is. So what you're seeing here is basically as the households get a little bit bigger, right, their effective rate continues to sort of go up with the number of exemptions versus the incomes that are, like I said, looks like 200 and below, right? So it goes up for a little bit, but then starts declining as you get into some of those harder ones. So basically, two things are happening. You're effectively reducing the effective tax rate for lower AGI households and raising it for higher ones. And gets to Charlie's point is the phase in when it starts and then what the rate is really influences that picture. And therefore, ultimately, when we think about sort of the progressivity of it, when we measure it maintains the healthcare personal income tax maintains its overall progressive structure, where higher income households are paying a higher share of their income to pay for the plan.
So I think the question I have that it dawned on me in that other slide is that whether if we decide not to drop the soft cap, not have a soft cap, then that affects the family size rate readjustment. I think you used the term we need to fiddle with the family size rate readjustment. So one impacts the other. So it seemed to me then we'd need to decide to move forward with or without the soft cap. So then you can change the readjustment. Am I understanding that right?
Yeah, I mean, for sure. So what I think is in my mind is like it's fairly decided that we should be computing what the rate would be with and without a soft cap, right? So with no soft cap, right? What is kind of potentially the core proposal here? How might we think about different phase-ins and different levels to maintain that level of progressivity, right? And I think it is really kind of the direction here that yeah, and we can look at the same thing, right? If we offered a soft cap, right, what would it have to be? And a lot of that's like it's kind of shown here a little bit with just this table, right? If you think about column E is the no soft cap, where you can have a much lower family size rate readjustment relative to something where you do have a soft cap in place.
So when we're explaining to this board, given that probably the majority of us are in favor of dropping the soft cap, can we show the board these two different scenarios, just really laser in on, okay, if we did have a soft cap, it would the FSRR would be this, and then no soft cap, it would be this, just so
Yeah,
they
this is kind of the nice thing here is we kind of tick off different parameters, right? We get the EPT fairly settled. Then we can kind of isolate these different things with respect to the soft cap and the household size rate readjustment pieces. So
Okay.
you're not having to look at so many different permutations and comparisons, but yes.
Okay, thank you.
Great. So I feel like we got good direction there. Our last piece that I want to move us to is this idea of ownership. And so this has come up, I would say, it came up very directly in the board meeting in terms of feedback to this group, but I think it's also been something that has come up in discussion here, at least peripherally. So I think both. Oh, go ahead, Charlie. You want to seed something here before I kind of go through the slides, or?
No, I was just ready to. I was going
All
to
right.
chime in as soon as you said something.
Charlie's in the queue. Great.
Because I have a particular
Well,
thing I want to say. But yeah.
Great. Well, let me just get my points here, and then I'll get out of the way and let you guys talk. So right. I think as both Richard and Charlie said here, right, the current structure is pretty strong. I would call strongly progressive, right? Because you are increasing the progressivity of the existing contributions, and I think that's fine. A separate question is really about ownership, and this is not about progressivity per se, although it does affect it. And I think it also is related to this sort of the other side of the soft cap perspective. But I think I'm channeling some feedback from the board here is like ownership is really this idea that there should be some shared participation in funding a public system, right? It signals that everybody is got a direct link, that people should be engaged in it. There's a sense of stewardship, a sense of inclusion. And then from an equity perspective, although technically it could be, ownership is not about trying to shift the burden, right? So I think it's a distinct but a related idea. So if you so that's kind of called the sort of best case scenario, or I would say rationale for including something like this. And this isn't mine. I'm just trying to frame it up for discussion. And if you were to sort of say, okay, well, should we try to have these ideas around connection, engagement, stewardship, inclusion? How could you do that? Sorry.
Can I interrupt and say we
go
should
ahead.
admit John? I don't know if I can admit him, but somebody should admit John.
Oh. I will admit John. Great. And then I will. Great. Okay. Got John in. So if one were to sort of think about expressing this idea of ownership in your current structure of your revenue plan, right? Think of it as basically you're trying to set some minimum net healthcare personal income tax liability. And you could do that through a number of different ways, right? So think of it as like, oh, I'm a sort of, my AGI is 25,000. The current set of structures and exemptions, right, mean that I have no liability, like zero liability, which I think for the most part is pretty strong up until about 40,000, 45,000 in terms of the current piece. But what this would be saying is, should I have some nominal amount, right? Where just simply say like, oh, great, I'll kick in $10 or $100 or whatever it is. Or should everybody have some or progressively higher level, a non-zero, call it minimum income contribution that would rise, right, to our higher levels of progressivity at higher incomes. So lots of different ways to think about sort of operationalizing this. But I think the question I'm asking here is this something, since you've been asked to kind of weigh in on it, where are people and what are your thoughts? Go ahead. I'll get out of the way, Charlie.
So I think that we probably cannot ask for any contributions for those below like 138% of federal poverty level and still get Medicaid money from the federal government. But that might be a question that we ask about. So to me, it's likely that the question is essentially, should there be any tax on those between 138% and 200% of federal poverty level to provide this ownership? And my feeling is the answer is yes. And I would say that the percentage could be more than 1/10% or 0.3%. It may be even up to 1% or even more, perhaps. So one of the things it would do is it give ownership. It would provide a little bit more income so that overall tax rate could go down a little bit. It would also mean that the family size rate readjustment wouldn't need to be quite as large because we're getting some of that money from the lowest in the lowest amount of income. So in my mind, I would say we definitely should be looking at some tax rate on income between 138% and 200% of federal poverty level. And we should ask a question on somebody who might know, if we did have a rate on those below 138% of federal poverty level, would that jeopardize Medicaid money from the feds? I'll stop there.
All right. Thank you, Charlie. Go ahead, Cheryl, and then John.
I'll let John go first.
Okay.
He hasn't been able to say anything, and I'd also like to wrap this up afterwards.
Yep.
Well, yeah, I have a dubious distinction. 25 years ago, having been the administrator of the Office of Oregon Health Plan Policy and Research, when we got a waiver that allowed us to put co-payments on Medicaid, very modest amounts. And if Bruce were here, he would tell you that when he took over into the next administration, that was a complete mess. Even small amounts of money to people who are impoverished are a significant obstacle. And I absolutely would agree with Charlie's comments. I don't know that Medicaid, what Medicaid's position would be. That administration 25 years ago did approve that waiver, but it didn't work. Absolutely, there should be nothing for folks below 138 or 200 or something of that sort. My other concern would be administrative costs. Whatever solution we come up with, I'd hope they pay once a year, it's a minimal contribution, and it satisfies the folks who think that this is necessary. My final comment was, please don't anybody say that this is important so that these folks have skin in the game. They don't need skin in the game. Their lives are in the game. That said, if it's small, with minimal administrative expense, I guess I could go for it, but I'd be very careful here.
Cheryl, Charlie, then Jeff.
Yeah, I'm inclined to say something like over 200% poverty level. That's my first instinct. I don't know if we'll get to a conclusion with this and still be able to do what we need to do for the rest of the committee meeting. I know several of us have 12 o'clock meetings, so I'm concerned about trying to wrap this up, and if we need to vote on one thing, that's okay. I think we've got consensus on most of the rest. I wanted to just work through that, but if Charlie and Jeff can just make quick comments, then I feel like we need to wrap up. Go ahead, Charlie.
So this has nothing to do with payment at time of service. This is just an income tax question. And so to me, it's not, I don't think it's skin in the game, it's ownership. And I think those are very different questions. And so it's like, should there be some minimal income tax on those between 138% and 200% of federal poverty level? And I will say, I will explore that and bring it back to the committee. I think it's worth exploring.
Jeff.
I agree with John. I'm the treasurer of the Clackamas Free Clinic. I don't know, at the low end, you prevent people from getting health care. I don't know what the percentage should be where you start to have something contributed, but at the low end, it's got to be 0.
Great. So I think the consensus here, Cheryl, is we will do some work and show some effects. So thank you for that direction, and back to you, Cheryl.
Thanks, Morgan. So what I heard today, and correct me if I'm wrong, that we have consensus on the category A and B items. So yes to family size rate readjustment rather than the PPP, yes to 100% Medicare Part B credit for HCPIT, category B items, yes to lodging tax, no to sales tax, but still address the issue of sales tax in our report. No to sumptuary taxes, juice is not worth a squeeze. Yes to EPT structure changes with the removal of individual level wage deductions and small business exemption of up to $500,000. In category C, we haven't decided on the EPT credit. We're exploring phasing out EPT at higher income levels to equalize employee and self-employed. That's what I got from that. It seems like we didn't need to vote on that because we still need to work on it. Charlie, did you have something else?
I would say we've agreed that the EPT credit should be between 30 and 60%. We haven't agreed on a particular number,
Okay,
but we have a
okay.
range.
Yeah.
And it's not 0 or 100, it's 30 to
Okay,
60.
got it. Yeah, right. Okay, that's more precise. And then on the soft cap, we were talking about voting on it. And I think since we now have, I believe, all the committee members here, we can do that. So I believe the vote is to remove the soft cap entirely, but still, show our work, kind of like the sales tax. I don't remember if there was anything else we were going to add to that. I don't have it written down.
Sales tax and the other consumption taxes.
Right. Was that what we're going to vote on? Just very directly. Okay, so let's take a vote. Can we do a roll call vote? I think that'd be helpful. So,
Do you want to ask for a motion in a second and then do a roll call?
yeah, that'd be good. Do we have a motion to remove?
So moved.
Yeah. Okay, Charlie.
Second.
Okay, we'll just say Mary Lou. Okay, any other discussion before we vote? Okay, so let's do the vote by roll call.
Cheryl Ramirez,
Yes.
John Wei Chi is absent, Mary Lou Henrich,
Yes,
Richard Gibson,
Yes,
Jeff Goodman,
No,
John Santa,
Yes.
Bethany Stairs,
No.
Charlie Swanson.
Yes.
So that's 4 yes, 2 no, and 1 abstention, so it passes.
Okay, thank you. Thanks everybody for the discussion. And then the last item was on ownership, and we're going to explore payment options. It didn't seem like anyone really wanted to do it below 138% poverty, so it's just a matter of where we start. And so we'll look into that. I think that was everything. So I'd like to now move very, very quickly to the committee work plan. I would say just briefly, I know Mimi has a slide or two. I certainly heard you say that you believe we need more time and that we shouldn't stop in February. And I've always thought with the purpose of the committee being to recommend a revenue plan, my thought was always we're done after we've provided our best plan, our best recommendations for the plan, and the board votes on it and approves it. And so to me, I guess that timeline is a bit fluid because we don't know if the board will approve our final recommendation, if that happens to be in February or not, because they may still have questions or ask us to adjust the recommendation. So it's really hard to say for sure. It's got to be, February, but I'm certainly open to extending the committee, and I don't feel like that's my decision alone for sure. So I feel like there's some flexibility there. I do believe though that in order for getting back to the meeting materials, in order for Echo Northwest and the staff to be able to give you timely materials so that you have time to read and absorb the materials. I should say we, because I'm included, in time for the committee meeting and to be able to discuss and have thoughts about it. I don't believe that's possible when we continue having 2 meetings a month. And so what I would like to suggest is that we do not have a second meeting in December and just let them do their work, including, I would say, Richard and Charlie, because they've been really involved in this. So I would prefer we do that. So that's what I'm putting out there. And I'm going to ask Mimi to jump in because you may want to show the timeline as well.
Yeah, thanks, Cheryl. Yeah, Isabel, if you just want to go right to the next slide. Sorry, again, this was probably a little bit small for people, so apologies. So what I think what might be a good option, and Cheryl and I have been talking about this, is so a couple of options. One, I think that we're definitely today's meeting showed that there's going to be more work for sure is around a plan for plan reserves. So start our cost, the funding for plan reserves. So I think that certainly is not going to be wrapped up in January. So I think that definitely will take a little bit more time. If you look at this, you'll notice that the transition committee is going to start up in March. And one of the ideas is that the work of the Finance and Revenue Committee that needs to continue will continue on in the guise of the transition committee. And so certainly people who are on this committee would be welcome to join the transition committee, and that would be a subset of the transition committee. Because as you can see, there is going to be the other thing that's in here are those targeted engagement meetings. So in February and March, Diana Banco is going to, go out to these different groups with the proposal as it is. There's going to continue to be feedback, and then that iterative process is going to continue throughout May and June. And I think, Mary Lou, you've for sure been alluding to this a lot. And just for everyone to be aware, May and June is when the board is going to do a lot of that work, revising the revenue strategy, and aligning it with, plan design and expenditure. Can we keep can this continue to be the PEB Plus plan that people have asked for, et cetera, et cetera. So having said all of that, I think that, certainly the work is not going away, and certainly the input of the people who are in this group is always welcome. It just, like I said, may take a different form. And I'm going to work with Chair Ramirez, and also Judy Richardson, who's the vice chair, is going to be the person who's taking over the transition committee, and kind of come up with a plan. Does it make more sense to have it running sort of parallel to the transition committee or move in? So I think there's going to be more on that. And then Charlie, you have your hand.
Yeah, I just put a question in the chat, but essentially, we're going to have a report to the December board meeting, and I would like the whole committee to be able to look at it as individuals and give feedback to that report, because it sounds like we aren't going to have another meeting before that, and we need to have the report in probably before we'd have a meeting anyway. But it seems like all of the people on the committee should be able to look at that report and give some feedback. And I don't know how many iterations we can do without, a meeting in there, maybe none, but to me, that's a minimum thing that needs to happen.
I just want to speak to that point. You're right, Charlie. We'd have to have our report into the board before the supplementary meeting anyway. So it makes sense to me just to do that feedback electronically if that's possible. I would defer to Mimi on that.
Yeah, I think that certainly any comments can be, if people have, and again, I think that this is not the final report. This is just, we would comment upon the progress that has been made today. Essentially, we would share all of the decisions that you all have made in this committee meeting. So it's not an official report, and which really the final recommendations aren't coming from this committee until February.
Jeff?
I'll defer to John first.
John?
Yeah, well, I have a number of concerns, but I think my unique one is Medicare. I cannot vote for any recommendation to the board until there's been an analysis of the same sort that has been done on employed folks and self-employed folks for Medicare folks. I don't understand, why there isn't more concerns being raised. I mean, and I want to make it clear, I'm not critical of Charlie here. He's doing an overwhelming amount of work. But I just don't see a robust analysis that has been discussed by this committee. And that analysis may well cause some adjustments to be made on these other populations. There's a blind spot here that's just becoming a sinkhole, that's just yawning, and I'm just surprised there's not more concern about it. I would just state, I ain't voting for any recommendation to the board until there's a full-fledged Medicare analysis shared with the public that will convince anybody that they got equal attention to these other populations. Thanks.
Mimi, I don't know what the best way forward with this is. Is it something that like John meets with Echo Northwest, or how would we handle that? So that
Yeah, I think that's a great point. I think one thing that might be beneficial, that's an option for sure if John is willing to do it at a time, or even John just to meet with staff. I think to have a full understanding of the additional parameters. I know certainly in this presentation there wasn't the Medicare population. In other presentations they have been represented, but I definitely want to get a clear picture from you precisely what you feel has not been done so we can fill that gap. And we can.
It's simple.
Yeah.
I mean, I can look at Charlie's spreadsheets for both of those populations. I can understand what's going on. I can see the trends. I can understand what happens when they get the tax credit or they don't, or it's 30% or 50%. That's not something I can do. I'm hoping it's something Charlie can do when he has the time, and he may need resources to do it. I'm happy to meet with anybody, but that's what I'm going to tell him. It looks to me like right now the whole focus has been on employed people and self-employed people, and there has been virtually no analysis on Medicare folks, because you can't show me a spreadsheet like you can on the other two. That's where I'm at.
Okay, so next step will be for staff to meet with John and figure out where we go from there with Echo Northwest and Charlie, some combination. Okay, Jeff?
I think Charlie wants to respond.
Okay, go ahead, Charlie.
I understand what John wants, and I think I can provide it, but I don't think I can provide it in any timely manner. It's going to take a bit of time, and I'm not even sure I can have it by the January meeting, but I might be able to. But I do understand what he wants, and I can provide it. And I don't think a meeting with staff and Echo Northwest and John is going to be helpful in that respect. I think it's just something that's going to take some time to do. And I'll stop there.
I believe though that your work needs to be connected with the staff. I mean, they need to be in the loop, and so does Echo Northwest. So you're all kind of going down the same path. So I think some meeting among you all should happen.
Yeah, if you're,
I appreciate
apologies.
volunteering though. That's great. So
Yeah, if you're able to communicate with us, Charlie, kind of the specifics, and that'll be helpful, just so we can make sure that we're getting everything covered. Thank you.
Jeff?
Thank you. John's point is valid. We are an older state and we are aging. So to not have analysis of that population detracts from the report. Number two, if come February or March or whatever the point is that we submit a final report, if John or Charlie or anybody has an objection to the final report, and they want to submit a minority report. How do they go about doing that?
I don't know the answer to that question. I'm sure hoping we can get to consensus. So, I mean, we'll look into how that would happen, but let's try to get to agreement first. So with that, did you have anything else, Mimi, on the timeline? I know we're
No,
past.
thank you.
Okay. All right, so we'll stop there. There are no verbal public comments, but please read the public comments that you've received. They have, as already noted, they concern progressivity. There's one other written comment that I don't think has been shared with us yet, so we'll get that. And then with that, we're going to adjourn for today. Thank you for your time. Great discussion.
Be well, everyone.
Thank you. Bye.
Bye, everybody.